Okay, good morning, everyone. I think we're ready to start. Apologize for the delay. I'll call this meeting of the Standing Committee on City Finance and Services to order. We've moved our seating around a little bit just to accommodate various specific issues this morning, and we'd like to acknowledge first that we're on the unceded traditional territory, the Musqueam, Squamish, and Tsleil-Waututh First Nations. Madam Clerk, may we have the roll call, please?
Councillor Meggs is in the chair. Mayor Robertson, not in the chamber. Councillor Louie, not in the chamber. Councillor Stevenson. Councillor Dio. Medical leave. Councillor Jang, not in the chamber. Councillor Reimer. Councillor Ball. Councillor Carr. Councillor Affleck. Councillor DeGenova. You have quorum, Mr. Chair.
Thank you. As chair, I am suggesting for reports that have no speakers, presentations, or consideration items, we adopt the recommendations collectively in a single motion. There are no speakers registered currently for items 2 or 5. Does any member wish to declare a conflict of interest? Or does any member wish to hold these reports for debate or questions to staff? Okay, it'll take me a while to manage queue stuff here because there's a bit of, okay. Councillor Carr.
Thank you very much. Sorry, your computer is just firing up here. Could you hold number 2, please?
Okay. Councillor DeGenova, did you wish to hold 1, 2?
No, I'd like to hold 5 for questions to staff.
Okay, so that takes care of the ones that we want to get rid of. Does any member wish to declare conflict of interest on any of the other items or have that item voted on separately from the rest of the consent agenda? There is no consent agenda, so it doesn't apply. We need a motion? No, so that's we're not doing any of that. Okay, we'll go on straight to item number 1. Yes. 4. So does anyone wish to hold 4?
Yes.
Councillor Carr?
Thank you.
Okay. So unless I'm mistaken, that makes a complete set. Okay, thank you. So first we have a presentation on the opioid crisis. Mr. Mulcree, are you ready to lead off?
Thank you, Mr. Chair. Good morning, Council. I'll start by welcoming and thanking Dr. Kendall and Dr. Daly for being with us as well. I'm going to walk through a presentation pretty briefly this morning. Of course, we have staff here to address any questions, and then want to make sure that you have time to hear from Drs. Kendall and Daly on this issue as well. So the context for discussion today is essentially the 1-year anniversary of the public health emergency declared by Dr. Kendall on April 14th of last year. Over the course of 2016, British Columbia experienced a shocking number, an unprecedented number of deaths due to overdose, 922. As context is indicated on the slide there, that is roughly 3 times the number of people in British Columbia that were killed in motor vehicle accidents. So this is a very, very significant contributor to non-natural death in our province now. And the implications of this for individuals, families, and our communities is profound, can't be overstated. I'm going to provide a brief overview of the crisis from the perspective of the city's response, primarily our emergency responders. And then provide a brief update on the status of the initiatives that we've undertaken this year to mitigate the impact of the crisis, and then we'll turn you over to our medical health officers to speak further. So for 2016, as a recap, Council, Vancouver experienced 215 deaths due to overdose. That was the highest of any municipality in BC, although again, this crisis has certainly impacted every corner of the province. Vancouver Fire and Rescue responded to over 4,700 calls to provide medical response to patients suffering an overdose. Over the year, the city and our staff have engaged extensively with our key partners in health, Vancouver Coastal Health and Provincial Health Services Authority, housing, our first responders, BC Ambulance community, and of course the academic community, in understanding this crisis as best we can and identifying measures to mitigate it. And we've also spent a lot of time trying to pull together data to give us a picture of what's going on, working with data coming from VPD and fire, as well as integrating with data from the health sector. And I would say relative to, on our understanding, relative to other cities in British Columbia and Canada, we have a very robust picture from a data perspective. This year, unfortunately, there's really no abatement in this crisis. If anything, it's getting worse. What we've seen over the first, essentially, quarter, 3 months of the year is 110 overdose deaths in the city of Vancouver, which represents more than half of the total deaths over 12 months in 2016. So the rate is increasing. Again, the same pattern that we've seen previously in terms of where those deaths are occurring, primarily indoors, and males being more predominantly affected than females. For the impact on our fire department, overdose calls for the first quarter are up 109% over last year, and I'll give you some more stats. Fire Hall 2 on the downtown east side, which has really been the epicenter of the crisis. As you recall, the overdose calls for Fire Hall 2 in 2016 represented a 275% increase over 2015. This year, so far, we're up another 241% over the first quarter of last year. So extremely dramatic increases in terms of our medical response. Overdose deaths, and this data is based on, 2017 data is based on primarily the recent numbers from VPD, so they are subject to confirmation by the coroner, but at 110 you can see the pattern there. We're at roughly half of our total for last year, and again up dramatically over the historical trend in Vancouver. The calls for service and the need is distributed around the city. This map reflects the number of overdose calls responded to by the fire department between January 1st and April 9th. And again, you can see predominantly the downtown east side, but our first responders are assisting members of the public around the city. This crisis is not limited to the downtown east side. This map shows, essentially reflects the rate of fatalities, and I think what this indicates is the number of deaths relative to the number of fire medical calls in each of those neighborhoods. And there's a number of kind of specific details in behind this data, but what you can see in the downtown east side is 1 fatality for every 24 calls that fire responds to, as opposed to, say, South Vancouver, where there's 1 death for every 5 calls that fire responds to. I think the inference that we're taking from this is that the interventions that are being have been implemented in the downtown east side in particular, by the city and by other partners and by the community, are saving lives. The challenge is that those interventions and supports are not necessarily available around the city, and so we're seeing as a proportion higher fatality numbers there. Graph reflects on a weekly basis the number of overdose calls attended by Vancouver Fire. Consistently high. There are some peaks there, but as you can see, there is some correlation with the distribution of social assistance checks, but it's not a one-to-one. So there's lots of things going on the street in respect to the crisis and the drug supply that are impacting both overdose calls and also fatality numbers. So turning then to the interventions that the city's been working to apply. So first of all, to give you an update on a very significant development that Council has contributed to with a $1 million funding contribution is the opening and commissioning of the mental health hub at St. Paul's. That facility is close to operation. Opening is estimated to take place next month. This is a significant augmentation to the emergency services available at St. Paul's. Will take pressure off St. Paul's Emergency and provide specialized support to patients, both in terms of access to addictions, but also suffering from mental health. And the combination of those supports will be of significant benefit, we believe, to the patients that are most at risk and most impacted by the overdose crisis. With regard to the other investments that Council has supported this year with the additional contingency fund included in this year's operating budget, we'll provide you with just a status update on each of those. So starting with the funding that has been allocated to Vancouver Fire and Rescue. So the additional 3-person medic crew, Medic 23, has been operating since last year out of Fire Hall 2. The total calls and the pressure on Fire Hall 2 continues to increase. Overall responses from Fire Hall 2 to all calls this year are up 53% over 2016. The additional medic unit, Medic 23, this year has already responded to over 1,300 calls, including 371 overdoses. So that additional unit is having a significant impact in the city and is taking pressure off of the other 2 units that are based at that hall. So a very significant investment that's having a huge impact. The other funding allocation to Vancouver Fire was to provide additional health and wellness support, and particularly mental health support for our firefighters. We have now put in place mechanisms for access to extended enhanced supports for occupational stress injuries. So our firefighters now have access to those supports provided by an external provider. And we're in the process of filling a full-time dedicated position within Vancouver Fire that will support and coordinate their health and wellness programs. The community policing centers, the inflationary funding adjustment that was approved, that has now been flowed through to VPD. There's progress continuing to be made on the establishment of a new CPC in Strathcona. There has been a location identified for that operation. There's an interim board in place. That board is going through the process of getting themselves registered as a society, at which time there'll be a process to broadly engage that community in attracting both board members and volunteers, who will then determine programming and so on to be offered out of that operation. Funding for community resources, there were $10,000 approved for training for city staff, and we are continuing with those efforts to ensure that our staff are prepared to administer naloxone as needed. Peer in-reach activities, the city has provided a grant of over $66,000 to the Downtown Eastside SRO Collaborative to provide outreach into high-risk private SROs. As you recall from the presentation you received yesterday around SROs, those buildings house a significant proportion of vulnerable residents and don't necessarily have the same level of service as some of our publicly owned SROs. So this initiative is really targeting those buildings and those individuals who are resident there. An additional almost $55,000 has been set aside, and we're working through the details with Atira to support the establishment of a women's-only supervised consumption site. Destigmatization programs, there's $100,000 earmarked for that. The Healthy City Leadership Table is convening later this month, and that will be the focus of that meeting, is looking at the allocation of those funds in a way that would be most effective. Peer capacity and support, there's a $30,000 amount earmarked for that purpose. Our staff are currently engaging with housing providers to determine the best use of those funds. So we do not have a specific program or programs identified at this point. The $60,000 grant to RACAM to provide wraparound support for use on the Downtown East Side, that money is in the process of being dispersed to RACAM. So of the almost $3 million, $2.9 million allocated by council thus far, 92% of those funds have been committed or are in process, and we're still working to refine the plans for the remaining 8%. Other work that we're engaged in, the city staff have been working with our urban Aboriginal community. There's been 2 meetings convened this year thus far that have included representatives from the Ministry for Children and Family Development as well as the Ministry of Justice, focused on the impact of this crisis on Aboriginal families in Vancouver, and families in particular. We've heard a lot of stories regarding First Nations families and Aboriginal families who have lost parents or other loved ones, where children are now kind of having to deal with the impact of this crisis. So looking to provide supports to that community. The Metro Vancouver Aboriginal Executive is coordinating that response, and we are continuing to work with them to determine what role the city might play in facilitating and enabling that. The federal government, as you may be aware, has allocated money, $10 million as a one-time funding allocation to British Columbia. That money has not been allocated at this point in time. A $6 million allocation to Alberta, as well as a $100 million budget nationally over 5 years for a drugs and substances strategy. We are not clear on the details of how that $100 million will flow. For the $10 million allocated to the province, the city's position that we have articulated and that we would be intending to communicate to the incoming provincial government as something that should be very high on their agenda is the allocation of this $10 million. Our recommendation would be that $8 million of that be set aside immediately for expanding access to injectable substitution therapy, including diacetylmorphine and hydromorphone, and increase psychosocial supports for patients who are transitioning off of illicit drug supply in Vancouver, as well as funding, of course, to address this crisis around the province. I think we are interested to ensure that this type of supports that are available in Vancouver, and particularly on the downtown east side, are not limited to that neighborhood, that patients around the province can access injectable substitution therapy in particular. We see a clear need to invest in upstream measures to prevent problematic substance use and investing in early care learning, housing affordability, all those social determinants of health that have a significant impact on individuals, their ability to reduce the harm of illicit drug use and also avoid that. The city was earlier this month represented by Councillor Jang in a presentation to the Standing Senate Committee on Bill C-37, along with other representatives from British Columbia and around Canada. Dr. Jang, on behalf of the city, emphasized some key messages to the federal government, including that the approval of safe injection sites, that approval be or authority be delegated to the province, particularly in cases of emergency. That the process for application and approval of such services be streamlined significantly. We are Vancouver Coastal continues to work through the process with Health Canada for the 2 supervised injection sites here in Vancouver. And also that municipalities be brought into discussion in a much more robust way as key players in the response to this crisis. Additionally, Mayor Robertson is chairing a task force of the Big City Mayor's Caucus. Staff are supporting this effort related to or focused on the opioid overdose crisis nationally. There is work underway planning for a federal, provincial, and mayoral meeting in June of this year, which is a really positive step. And coming out of that, the Big City Mayor's Task Force is also developing consensus recommendations to the federal government for delivery this spring. And just as a closing slide for me, Council, this is just a photo. I'm not sure if you've seen this. This is the commemoration wall that has been put up on the downtown east side at Hastings and Columbia as an opportunity for members of that community to recognize the loss of their friends and family members. And again, it's a pretty stark reminder beyond the statistics of the human impact that this crisis is having and the significant trauma that's occurring both in that neighborhood and also around the province. So with that, Council, I'll defer to Dr. Kendall.
Good morning, and I thank Council for the opportunity to speak here this morning. I'd like to actually acknowledge the exemplary response by the City of Vancouver to this overdose crisis. It's almost a year since I declared the state of emergency under the Public Health Act, and I will give you a rather brief overview of the provincial response, and Dr. Daly will follow with more details on Vancouver Coastal Health Authority's response. This slide shows the incidence rates of overdose deaths in 2015 compared to 2016. And in 2015, you can see across the province that the rates varied from less than 5 per 100,000 to 10 to 15 per 100,000, and pretty much every area was affected. In 2016, you can see the increase in overdose incidence rates. They now range from 5 to 10 per 100,000 to more than 20 per 100,000. And in total, in 2015, we had 513 deaths, and in 2016, we had 922 deaths. What was really significant, I think, in driving this increase in overdose mortality is the fact that when the coroner's office investigated these deaths, they find that the amount of fentanyl that's present in the deaths went from 30% in 2015 or 35% in 2015 to 60% in 2016. And if you subtracted fentanyl from the overdose death numbers, the numbers are relatively stable compared to what they were in 2012 or 2011 or 2010. So the increase, I think, our conclusion from this is that the increase in this is driven by that very potent, very toxic synthetic opioid fentanyl. This shows the month-by-month pattern through 2015 and 2016. You can see the increases at the end of calendar 2015, and the red arrow indicates where the minister and I declared a public health emergency. And perhaps you could see as well that up until about September, October, we thought that although the numbers were high, if you fitted a statistical line of best fit, we were cautiously optimistic that we were getting a handle on this and that the numbers were starting to come down. That was until November and December, when the statistics showed that startling increase with an almost doubling of the numbers of overdose fatalities, which really reversed that trend. And why? What happened here? This is coincidental with the finding by the Canadian Analytics Services and by police across Canada, actually, of carfentanil in the illicit drug supply. Carfentanil being reputedly perhaps 80 to 100 times more toxic, more potent than fentanyl. So our working hypothesis is that we had a new, very dangerous, even more dangerous synthetic come into the illicit drug supply, and that is the result. That resulted in this increase in overdose fatalities. This is not a simple problem, obviously. It's been a long-standing issue in Canada. When I first came to BC in the 70s, British Columbia had one of the first mandatory heroin treatment programs in Canada, which was ruled unconstitutional, but it does speak to the fact that BC has had an issue with illicit drugs for many years. If we look at this rather complex interaction, which I credit to Dr. Kate Smolina, who's the director of the Population Health Observatory at BC CDC, we can see that Canada, the demand for opioids, Canada has actually had the second highest per capita use of opioid drugs globally. The drivers for the demand for opioids are not only prescription, and during the 90s and 2000s we had an issue of overprescribing opioids. They were being marketed as safe and non-addictive. The degree that this played a problem in BC is unknown. It's clearly played more of a problem in diversion and overprescription in other parts of Canada and in the United States. But we had a demand for opioids. We have a demand for illicit opioids and illicit drug supply, diversion. The advent of synthetics coming from largely, according to the RCMP, from illicit factories in China, coupled with easy access through the internet, and the fact that very small quantities will yield very large amounts of drugs, which can be brought in through the mail very easily and escape detection, kind of changed the game plan for the market. We have been working in a number of areas. So the College of Physicians and Surgeons have new prescribing guidelines so that moving into the future, fewer people will become addicted through inappropriate prescribing. There will be less diversion to the illicit market, but I'm not sure that that's a very strong component here, given the importation from overseas. We are significantly working on building up the addictions treatment system in BC, opioid-assisted treatment particularly. And I'd like to note here that from 2015 through 2016, we've seen the number of people engaged in opioid-assisted therapy go from 16,000 to 19,000 to 24,000 last year. And a lot of that increase, particularly in 2016, was to Suboxone, which is a mixture of buprenorphine, and naloxone, which is a safer opioid maintenance drug, rather safer than methadone. We have invested in the BC Centre for Substance Use, which is doing clinical trials. We'll be taking oversight of the opioid treatment program in BC from the college. We've worked with the college to make access to these drugs a lot more simple. And we have now, since in 2016, 809 physicians who are prescribing Suboxone versus prior to that only about 250 odd. So increasing access to treatment is really important to bring people out of addiction into a safer modality. We've also linked across to the recovery community so that people can transition from OAT into more ongoing supports. There's an increase in the number of beds. Beds aren't the most important piece, I think, here, but we've also increased access to community supports and community follow-up, which evidence shows is really important. In terms of responding to overdoses, I mean, Vancouver has been an example of this, but it's across the province now, first responders equipped with naloxone, community members equipped with naloxone. We've distributed some 28,000 kits across the province, and many of them are being used. The minister, under an emergency order, opened up overdose fatality prevention sites, or ordered regional health authorities to do that. We have more than 20 operating across the province. They have seen since December thousands of people, reversed hundreds of overdoses. So I think that although we still have an ongoing, really significant problem, we clearly are not ahead. We clearly cannot, at this point in time, relax in any way. I think we are building an infrastructure that is responding to this problem appropriately. We do need to do more in that area, quite clearly, but we have a foundational piece in place now on which to build. And if we look at what is needed next, we do need more accessible access to opioid agonist therapy. We need more prescription options available, including injectables. We need to build the system and a continuum of care so that people who are at risk can be inducted into the system, can be followed through the system, can be monitored, and can be helped. We need more of a discourse around stigma. There is still opposition to providing drugs to people who, quotes, don't deserve them. But it's important to know that the work that you are doing and that other jurisdictions are doing is having an impact there. And we do know that overdoses are affecting people across the entire social spectrum, sort of our children, our families, our relatives, people we know. I think it's important to have a look at the regulatory framework. This will probably be difficult discussions around potentials of decriminalization or other regimes. Portugal is an example that we might want to look at. I work with the public safety component on this in the joint task force that was appointed by Premier Christy Clark, and they will acknowledge that we're unlikely to arrest our way out of this. Although I think that there's a lot of opportunity for treatment, I think we're unlikely to treat our way out of this. So I think it is time for a discussion to look at, are there alternate regimes that might offer Canada better options than we currently have? We need to focus upstream on early childhood development, on building families and supportive communities. We obviously need more supportive housing. And I think that to the degree that this is driven by opioid prescriptions for pain, and to the degree that new prescribing standards from the colleges across the country will be leaving some people underserved, I think we need to create these options for better management of pain and decrease the overall per capita prescription opioid levels that we're seeing in Canada at the present time. So that just concludes my rather brief overview of the provincial response to this, and I think I hand it over to Dr. Daly.
Thank you, Mr. Chair and Council, and thanks to Dr. Kendall for joining us as well today. And I would first like to also acknowledge the great work done by this Council and City staff in supporting the response to date in Vancouver for this very challenging public health crisis. And I'm going to start by focusing on some of the more specific numbers for Vancouver. So this is a graph that of the number of overdose deaths that comes from the coroner, and I've graphed it starting from January 2016 till February 2017. So it's not rates, and there are different populations in the 5 health authorities graphed here. Whoops, we'll just go back to that. The Vancouver Coastal Health is in green, and most of the overdose deaths in Vancouver Coastal Health are in Vancouver. The other parts of our region are Richmond and the coastal region, North Shore and coastal region, and they actually have the lowest overdose death rates in the province. So our high rate is driven almost entirely by Vancouver. But you can see that deaths have occurred across the province, as Dr. Kendall noted. And you may remember back last summer, maybe in May or June, I came to speak to council about how we were doing. And if you look at the green line in May, Vancouver in May had amongst the lowest reported number of overdose deaths of the 5 health authorities, down near Northern Health, which has a much smaller population. And I talked about the fact that the rate of increase had not been as high in Vancouver compared to a number of other municipalities in the province. And we felt that was because we had a lot of very good harm reduction programs in place. However, what happened towards the end of the year, and Dr. Kendall showed you this provincially, is we saw a dramatic rise in the number of deaths, and actually led by Vancouver and Vancouver Coastal Health in November and December, which we believe was due to the arrival of carfentanil. So that by the end of the year, Vancouver Coastal Health did end up having the highest overall rate of overdose deaths of the 5 health authorities in the province. Having said that, they were all very close, very high rates in all 5 regions. 215 deaths in Vancouver, as you heard from Paul, out of 922 deaths in the province. Surrey was second with 111, Victoria at 66, and then Kelowna and Kamloops after that. So this has affected every area of the province, but certainly the highest numbers in Vancouver. Now this graph, and you've seen me present some of this data before, and we post this actually publicly on our website every week. We monitor the number of emergency department visits to all of our, to 9 emergency departments for overdoses every week. We've been doing this actually now for close to 7 years. This shows the overdose visits from September 2016 right up until the beginning of April, so the first week in April. And we know, there's some things we know about this data. First of all, the overdoses includes many other things besides opioids and fentanyl. We know that most of the emergency department that has the highest number of visits is St. Paul's Hospital. Actually, they have 80 to 85% of all overdose visits in our entire health authority. And we also know, looking at the numbers, that the visits, just as the deaths, they were very high in September, October, but then rose dramatically, as you can see, in November and December. And you can see a week there in December where they were extraordinarily high. It was the week of social assistance check distribution. Now, you may recall that at that time, we heard from our BC ambulance, from our staff working at St. Paul's, that they were overwhelmed. The ambulance was concerned they couldn't respond to other calls besides overdoses, particularly in the downtown east side. So really working with our partners at Provincial Health Services Authority, we deployed the mobile medical unit in the downtown east side in early December. And the dark green bars you see in December are the overdoses that were brought to the mobile medical unit. So they did take some of the pressure off St. Paul's Hospital and the BC Ambulance Service, because the turnaround time for the ambulances for drop-off was much shorter, given the mobile medical unit was close to where the overdoses were occurring. So that really helped our first responders in managing the crisis in December in particular, and in January. Now, you will notice over time those green bars get smaller and smaller. So the number of overdoses, even though we don't think the deaths have necessarily come down. So on my previous slides, even though the The February deaths were lower in Vancouver Coastal than January. There were fewer days in February. Based on the preliminary data Paul showed you, we don't think in March deaths are down, but certainly the overdose visits to the emergency and to the mobile medical unit did appear to come down in March in particular. We think that's because of the overdose prevention sites in the downtown east side where they're also treating overdoses. And many people who are treated either refused to go by ambulance either to the mobile medical unit or to the emerge. So there were, in fact, as March wore on, fewer overdose visits to the mobile medical unit. However, of the approximately 2,500 people seen at the mobile medical unit since December, only about 500 to 600 were for overdoses. The other 2,000 were people who walked in who were interested in starting on addictions treatment or were accessing other services. And we had decided, or actually our emergency colleagues, when they established the mobile medical unit in December, decided to include an addictions physician at that unit, initially 18 hours a day as of January, 12 hours a day, 7 days a week, specifically so that people could walk in and start therapy. And I don't think we anticipated how successful that model would be. We realized that even in a city like Vancouver, where we have great expertise amongst our addiction physicians, that there are many people who aren't being well treated, who aren't being able to access treatment. So that was an important lesson learned, and we have, although we're transitioning the services now at the mobile medical unit, we are incorporating that into other services in the city, so I'm going to talk about that. But I just want to show one more slide. In addition to monitoring overdoses at emergency departments, for a number of years, we've been monitoring the overdoses treated at Insight, and this is that graph. And you'll see that back in September, there were maybe 20 overdoses every week treated at Insight. And just as we saw in the emergency departments in December, a dramatic rise, up to 120 overdoses in a single week. You can imagine the impact that had on the Portland Hotel Society and Vancouver Coastal Health staff at that facility. So in addition to the mobile medical unit, the other thing that we opened in December, and this was really at the urging of our provincial health minister, Terry Lake, were overdose prevention sites. And we thank the city for assisting us and supporting that work, and the Vancouver Police Department as well. We have 4 now operating, Miranda, is that right? 4 now operating in Vancouver. They are seeing collectively about the same number of people visiting per day as Insight, so around 500 visits per day, and they also are treating overdoses. So the green bars represent the overdoses treated at overdose prevention sites, and you can see over time that they're not up to half, but they're treating a significant number of overdoses are now being treated at those locations. So we believe that service has been worthwhile. There's been no deaths at the overdose prevention sites, no deaths at Insight. And even though the death rate in December and January was really high, 98 deaths in Vancouver over that period, we think it would have been even higher if we hadn't had the mobile medical unit and the overdose prevention sites in place. In fact, we've done some statistical analysis around that based on the trends over previous years, and we're quite certain that those services prevented deaths. But I do just want to summarize the things that we have done over the past year to respond to the crisis. And although it says this was the Vancouver Coastal Health response, I need to acknowledge that this was done in partnership with Providence Healthcare, who operates St. Paul's Hospital, with the Provincial Health Services Authority, particularly the BC Emergency Health Services team, which includes the ambulance and the team that deploys the mobile medical unit, with our community partners, including Portland Hotel Society, the Vancouver Area Network of Drug Users, Lookout, many other agencies that operate social housing in the downtown east side. But I want to acknowledge Miranda Compton, who is one of my staff at Vancouver Coastal Health, who really has led much of our overdose response. She's the person who got overdose prevention sites operating within 24 hours of the minister asking us to do this, and has led the naloxone distribution, supported the mobile medical unit as well. So I want to acknowledge her, and she's here today as well. The first thing we did with the declaration of the emergency was the emergency response of getting naloxone out where it was needed. And Perry's already talked about the distribution of that around the province, and we continue to do that because as you've seen, there's still far too many deaths occurring. 90% now of the deaths are occurring indoors. If you have an overdose outdoors, because you're more likely to be seen, it's much more likely that someone will be able to respond and administer naloxone. But if you're indoors, the risk is much higher. Of the deaths occurring in Vancouver, half of those deaths are in shelters, supportive housing units, and about half are in private residences. So we know we need to get naloxone out to some of those facilities as well. The mobile medical unit was a great an important service. It also, I think, was appreciated by the community because it showed them that their lives matter. We thank the city for helping us get that operational. The mobile medical unit is still on site, but we are transitioning the services out of that unit now. So the model of being able to drop off, having the ambulance drop off overdoses there, has now transitioned to Connections Clinic. This is a very innovative model because up until recently, BC Ambulance, if they picked up a patient on an emergency call, had to take them to a hospital emergency department. Thanks to the health minister for signing an order that allows BC Ambulance now to drop off those patients elsewhere. We've started now having ambulances drop off those lower risk overdoses at Connections Clinic. The model that I talked about of clients being able to walk in to start addictions treatment is now incorporated into 2 new clinics that have opened in Vancouver, the Connections Clinic, and you see the sign there of the Connections Clinic, and the RAC clinic at St. Paul's, which is the Rapid Access Addictions Clinic. And that will be incorporated into the services at the hub that Paul talked about that will be opening in May. And that's a really great model. And again, we thank the City of Vancouver for their support for the hub. Given that those clinics have opened, that we've been able to transition the services from the mobile medical unit, our plan right now is to end the deployment in May, but we wanted to keep it on site for several more weeks in the event that it has to be reactivated. You've heard that we have applications pending for 2 new supervised consumption sites in the downtown east side. One's on Powell and one is our new Heatley Community Health Center. You've heard me say this before, the federal process for obtaining exemptions to operate these sites is far too slow. We really appreciate Perry's efforts and the Minister of Health's efforts that allowed us to open the overdose prevention sites. In fact, one of the overdose prevention sites is operating at one of the future supervised consumption sites, and it will continue to operate until we get an exemption. But we really need to change the process federally. 4 of the 5 health authorities have applied for exemptions for supervised consumption sites, and a year into this crisis, there have been no new ones approved to date. So that needs to change. Going forward, our priorities in Vancouver, I mentioned that we still have work to do to make sure that staff working in support of housing units, whether they're publicly funded or the private SROs, are trained in administering naloxone. Ideally, that they would identify a place in those buildings where residents could come and consume their drugs. So if they suffered an overdose, someone would be able to respond. We do need to dramatically expand opioid agonist therapy. There are 130 people approximately receiving either injectable diacetylmorphine, which is injectable heroin, or injectable hydromorphone at the Crosstown Clinic, operated by St. Paul's Hospital in downtown Vancouver. Those patients were part of the Salome research trial, but we haven't so far been able to expand that apart from a small number of patients of Dr. Christy Sutherland, who's the medical director of Portland Hotel Society. She's been able to prescribe injectable opioid agonist therapy for a small number of her patients. The oral opioid agonist therapy, we are dramatically increasing availability of that. And we have over 300 physicians and nurse practitioners in our region who are prescribing oral opioid agonist therapy now. But we need to ensure we have a good system of care to be able to offer treatment as soon as people are ready for it, to follow them through the treatment process. If they're not willing to take an oral therapy, perhaps they're willing to start with an injectable therapy. We need to consider all options going forward because this is getting people off the contaminated illicit drugs and onto an alternative where we can stabilize them, where they're at much lower risk of serious consequences or death. When we talk about addressing stigma, I don't think I even appreciated how important this particular part of the response is, that perhaps many people are dying indoors because they're not willing to come to either an overdose prevention site or in-site and admit that they are suffering from an addiction. Perhaps people aren't calling 911 because they're concerned about what might happen if drugs are present where that overdose occurred. If we can decriminalize all drugs as an important first step, it doesn't eliminate the contamination, but I think it will go a long way to addressing stigma, to acknowledging that the substance misuse is a medical condition. I think that's critically important, and we need to advocate for that. We do need to move upstream, and Perry's talked about early childhood development. Housing is important for prevention. We also need to continue to engage, identify, and support vulnerable youth. And I would mention In particular, the SAUCE program offered at Vancouver School Board, working with Vancouver Coastal Health, that program should be expanded. And early childhood development, because we know that most people, some people would say everyone suffering from addiction has suffered trauma. It could be multi-generational trauma that we see in Aboriginal communities, who, by the way, are overrepresented in the deaths occurring in Vancouver. Or it could be other forms of childhood trauma, so we need to address that going forward. And I'll end there. Thank you.
Okay, I think it's time for questions. If that's our presentations, thanks very much for a discouraging update in some respects. Councillor Jang, you're first.
Thank you very much, Mr. Chair. And questions for Dr. Daly or Dr. Kendall. The numbers you show are sobering. And just as you said, we thought we'd have a handle on it in the spring. It shot up over December, and looking at the graphs, you can't even get a best fitting line in there. It's so bad. So one of the questions I was asked while I was in Ottawa was actually, are you able as a province, got a handle on this, that you can actually start setting targets for the reduction in number of deaths, either by quarter or by year? I didn't think we were, and that was sort of my answer to them. I don't know if you have any comments on that.
I think we can, thank you, Councillor, for the question. It's a good one. I think that we can set targets on building a response capacity. I wouldn't feel confident about setting targets to try and target looking at the overdose fatalities. But I think building a response capacity, trying to set targets for the number of physicians, the number of nurse practitioners who could be engaged, setting a target for every regional health authority to have a centre for excellence in addictions, that I think we could do.
Okay. Much has been discussed around the 10 million that the federal government provided the province for the response. And looking at, we were looking at some of the limitations we currently have. We have a limited range of injectables, primarily methadone and Suboxone. There's a 10 or 15% of folks who are going to need something else, as you pointed out, diacetylmorphine or what have you. And looking at, year over year now, I've looked at one of your reports that shows methadone, people staying in methadone treatment has actually been fairly low. When you think about after 12 months, only 32% of the people actually are still in treatment, suggesting that we have a real problem with psychological support systems to keep people in treatment. Now that we have this $10 million, what are the plans for it? Are we going to be scaling up for the future, given that this crisis doesn't seem to be ending or abating? And what would it actually take? I think people need to understand the puts and takes to actually scaling up new agonist therapies and psychiatric supports for the long term. Could you talk about that a little bit?
Sure, to the degree that I can. It's important to realize that the 10 million is a one-time, it's very welcome, but it's a one-time infusion from the federal government. So we are targeting it at interventions which would be, say, for example, training, building a capacity, building a network, recognizing that the ongoing expansion of this treatment, and we have asked regional health authorities to give us some estimates of what the gaps are if you were to develop an ideal model, and the gaps are, well, tens of millions more than the 10 million we have. So we're trying to use the 10 million as investments that would be useful for a one-time investment, training, building capacity, building networks, putting in place one-time capital expenditures, perhaps for supervised consumption sites. All of it will be dedicated to the health side of the response. And then we'll be relying on regional health authorities and the provincial government to either reallocate or to bring in infusions of additional resources to meet the needs. And clearly that will be happening.
Okay, is that... I guess then the follow-up question to that would be, so how soon do you think we can start having some of that infrastructure in place, given the limitations we have now?
Talk about in our health authority, because we are committed to improving the addiction treatment system. I think that's key. And it's not just about injectable opioid agonist therapy or even Suboxone, which, by the way, now is the preferred oral treatment. I think methadone, you're right, has not shown the same levels of success as Suboxone. We need to be able to track patients through the treatment system. This is a chronic relapsing condition. Many people will relapse. I can't even give you good numbers in our region about the number of people over the years we've referred from Insight for treatment. How many have successfully completed treatment? How many have relapsed? We don't have that kind of data to be able to monitor that. So we're talking about building an addiction treatment infrastructure that is critically important to be able to monitor that. And to be able to identify best therapies and get people on it. You may have heard me say when people have called for more detox beds that that's not my preferred strategy at the moment, because what the experts tell me is people coming out of detox, because we don't have a good system to ensure that they're being monitored and tracked closely, they're actually at higher risk of death. And we're seeing deaths when people come out of detox or even recovery homes or jail because they've been off their opioids for a while, they relapse, and they don't have the same level of tolerance to the amount of drug they used to take. So that's why I'm suggesting that we're not referring people to detox as our highest priority right now. We need to build this addiction treatment system. And we are committed to that in Vancouver Coastal. We're working with Evan Wood and his team. And it's going to take some time. We have to do better training. We have to have the information systems. But clearly, that's what we need to do to begin to see the numbers turn around.
Great.
And
Thanks,
if I can add to that, I fully agree. I actually was on a teleconference for an hour last night with all of the addictions physicians who work in the correction system, talking about some of the gaps that there are between people who are brought onto opioid agonist therapy in jails, but then discharged to the community without any follow-up, or are discharged to treatment centers where their first priority of the treatment center is to run them through a rapid taper off the opioid substitution that they're on, which then makes them very vulnerable to relapse, very high rates of relapse. So we do need to build that system. I think it's not a question of when, but we've already started in 2016, made some significant investments there. Even among addictions treatment physicians, the idea of injectables is not universally accepted across the field. So we have to figure out where it's ready to move in that area, and where we basically first need to build up just first-line treatments with more access to methadone or Suboxone before we can even kind of think about investing in the injectables. Unfortunately, it's going to be a staggered, a staged approach, I think.
Okay, thank you very much.
Mayor Robertson.
Thank you, Mr. Chair, and a big thanks to all of our presenters here for being here. If I may, Mr. Chair, if I could just, well, if you want to use a moment of my time, I really appreciate the debate, but given the circumstances and the number of people who've been dying in our streets, if we could just take a moment of silence for the people that we're losing, because that's why we're here, if that's okay with the chair. Thanks, everyone. I could probably spend the whole 5 minutes like that, given the circumstances, but we're here to help take action and make decisions on how to stop the tragedy. And once again, a big thank you to Dr. Kendall, Dr. Daly, and our staff team for all the good work that you're doing to try and grapple with the most horrendous death toll that we've seen, preventable deaths here in Vancouver in such a short time. My questions, I'm hesitating in going into where's the 10 million, why isn't it being spent, why has there been not more dramatic action from the provincial and federal government? Because I feel at deep down incredible frustration and anger at the number of people dying, and despite many people's best efforts on the ground, it's not slowing down. And I would ask Dr. Kendall and Dr. Daly, maybe to start, if we start with the federal level, there's lots of finger pointing that's gone on. This is affecting all of Canada, and I hear it from mayors across the country. What would your key recommendations for the most effective actions our federal government could take to support us here in Vancouver and across the country to turn the tide on this fentanyl overdose crisis?
It's a tough question. First of all, let me say that I think with this crisis, there's goodwill at all levels of government. At the provincial level, Minister Terry Lake's been a real leader in our response. At the federal level, we hear from the Health Minister and the Prime Minister, their commitment in responding. But if I was going to make a recommendation, and you saw, I think Paul had in his slide, one of the things I would recommend, first of all, for supervised consumption sites, we need to change the way that exemptions are granted. This should not be occurring at the federal level. This is a health service and should be a provincial responsibility. This is a problem not just in BC. I was meeting with my colleagues from the Western provinces last week in Edmonton. Alberta would like supervised consumption sites. Ontario would like supervised consumption sites. Montreal has taken a long time to try and get supervised consumption sites. This process is far too cumbersome. And it also applies to the ability to prescribe injectable diacetylmorphine or injectable heroin. This is available through the Health Canada Special Access Program, but the requirements that Health Canada puts in place on the Crosstown Clinic are costly and cumbersome. Those same requirements aren't needed for hydromorphone, which is the other drug given at that clinic. And it was that one of the reasons they did the Salome trial was to show that alternative, which is a legal drug in Canada and manufactured and available here, can also, the results are as good as with injectable heroin. One of the reasons they had to do that is because it's hard to get the heroin. It's easier now under this government than the previous government, but I do think that those kind of decisions need to be made at the provincial level. I think we'd be much more nimble if that were the case. Of course, the issues around funding, I'll leave it to you. We need to have funding not only to respond to the emergency, but we need to think about more housing support and early childhood development. I would say is something I've been championing for many years in my public health career. I've often said early childhood development is the vaccine against mental illness and addictions, and we do abysmally in this country in providing support for early childhood development. So that's something that certainly the federal government could help address.
I agree with Dr. Daly. In particular, I think that from a provincial level, we'll be trying to build up the response through 2017, that I think there's going to be a need for all levels of government to contribute, because we are going to need more resources for this.
So dramatically more funding would help with addictions and mental health. This question around ensuring that everyone who needs treatment, who wants treatment, can get immediate access, and we've heard this from our police chief. I've heard this from both of you and many in the health and medical community, that treatment on demand and access to those opioid substitutes, hydromorphone and diacetylmorphine, those two. What is stopping immediate action to ensure everyone who's at high risk of death right now has access to treatment and those clean drugs? What's the barrier?
They do require prescriptions. They do require physicians or nurse practitioners to be trained and willing to take on these individuals. They do need access through community support, psychosocial counseling, housing, etc. It's not something, unfortunately, that you can turn on with the flip of a switch. We have seen, and we are seeing, as I said, I mean, last year in 2016, we had 806 physicians who were prescribing or had prescribed Suboxone. That was up from 266 the year before, up from 150. So we're seeing a rapid progression, but it takes time. And to be frank, I think because of the stigma and chaotic lives that many folk have, they're not the most desirable clientele. We have something like 250,000 sort of unattached patients who aren't substance use people with mental health problems in BC who can't find a family physician. So we do need to work with doctors of BC and work with physicians and bring more nurse practitioners along to build the clinic access through regional health authorities, to build the supports that general practitioners who are at the front line will feel comfortable in taking on these patients. Many of them don't feel comfortable taking on or capable of taking on people with chronic, complex conditions. So it's going to take time to build that up, unfortunately. The good news is that we see now a movement. If anything good has come out of this crisis, is the attention that's being paid to people who don't have access to treatment and the lack of capacity in that system. I think we also need to work with the recovery community to build better bridges and to stop fighting about whose methodology is the most appropriate.
Thank you.
Just talk about the injectables. Just one comment that I wanted to make. The injectable therapy, it's unfortunate that not all addictions physicians are necessarily on board with this, because I think this is critical. Not everybody wants to go on oral therapy. There's going to be a percentage of people that are willing to take the injectable option, and they may start with that and switch to oral therapy, and there are people who are going to fail oral therapy. We need it. One of the things that I know, Mr. Mayor, you've been very good at is advocating for expansion of injectable therapies. We need mayors across this province to understand that it's important not to be afraid of having this in their communities. On May 26th, there is going to be a session put on by the Michael Smith Foundation, bringing experts from Europe, where they've been running injectable heroin programs for many years, to talk about some of the practical implications of those programs, not just what's published in the academic literature, but how these programs operate in those cities. And we would encourage any members of council who would like to attend. I know Councillor Jang is attending. If colleagues from municipalities around the province, some of your colleagues, perhaps if you could encourage them to attend, I think that would be a very worthwhile session and might help us get past some of the concerns in communities outside of Vancouver to operate these kind of treatment programs.
Thank you. We'll move on to Councillor Louis.
Thank you, Mr. Chair. Well, I appreciate the presentation. It does really bring to light how the gravity of the situation. There's no way to describe this other than a disaster. When you have this level of death happening in our city and around our province, and despite the fact that I know that our partners are working flat out trying to deal with this issue, that the increases in deaths continue. What I've heard today, though, is that there's some need, much more need, that there's foundational pieces, and Dr. Kendall, you've talked about prescription opioids and resources and regulatory framework, and Dr. Daly, you've talked about more supportive housing, and all these component pieces, what it tells me that we don't have a clear plan, that it doesn't appear that we have a clear plan and that it's a plan that is properly funded. And I know that there's resistance from some quarters to not properly fund, or there's not the capacity. But what stood out and what I've heard so far is that it takes time. The problem is that there's people dying and there isn't the time. And so when the mayor asks what's the priorities, it's an ask of how we can further our efforts collectively and reduce the amount of time. And so, I look at the 2016 amount of money that was spent by Vancouver Coastal Health, and I wonder, what was that increase to 2017? So maybe that's the question. What was the increase? Was it enough? And given the fact in the environment that we're in today, that we continue to see the deaths occurring, not just in our area, but across the province. How much are we asking of the provincial government and the federal government to increase? So maybe specific to our province, though, what was the increase between 2016, 2017, and what has been done given the evidence that we've seen so far?
Well, first of all, we have put forward budgets for the upcoming year in terms of both the emergency response and what we think we need to expand our addiction treatment system, which I think has to be our number one priority right now, getting people off the illicit drugs. The funding for our emergency response that's being funded by our health authority, and there's tremendous support from the leadership, our board chair, Kip Woodward, our CEO, Mary Ackenhusen, and we will continue with our emergency response. We will do what needs to be done. That's being led by Miranda Compton. We will continue with overdose prevention sites. We will open new supervised consumption sites. We will continue to expand naloxone. The addiction treatment system, the amount of funding required for that is significant. So that is something we need to continue to talk about with our provincial colleagues. Now, one of the good questions that the provincial government asked when we talked about this is, if we gave you the money, would you be ready to go tomorrow to implement this brand new addiction treatment system? And the answer is no, because we're still trying to train the docs. We would have to get the infrastructure. So I think there is commitment. I don't know how much we're going to be spending on it in 2017. I can't answer that yet. We haven't confirmed our final budgets next year with the provincial government, but we have put forward a significant budget to expand a robust system of addiction treatment for Vancouver Coastal that would include expansion of opioid agonist therapy, both oral and injectable, based on our projection of hundreds more people going on injectable therapy. And we're still in discussions about how much funding we might get from the province, how much we might reallocate internally, so I can't give you a final answer on that. But that is going to be our biggest need going forward in 2017.
So, but if it is a question of the province perhaps asking you the question, when can you bring that up online, then when is that going to occur? When can that occur? And rather than the province waiting for you to say we could do it or we're ready, and then we'll give you the funding, get them to give you the commitment early and say we will commit to the monies necessary as soon as you're ready, rather than reversing the equation.
So we have, our first response, Councillor, has obviously been to try and stop people dying and ramp up that first emergency response. We have asked the regional health authorities to give us their budget projections for what would be needed to do the next piece, which is to build the capacity in the system. And we have heard from them. I am neither the Minister of Finance nor the Minister of Health, so I cannot answer for them, but we are collecting that data and we have presented it and we will continue to present it as recommendations.
Thank you, Mr. Chair.
Thank you. Councillor Reimer.
Thanks, Councillor Meigs. So a few questions. It definitely looks like the investments that we've made as a city and that you're making at BCH are making a difference in the communities that they're deployed in. So the questions were around specifically more information about the supports for the fire department and how that's playing out. I have this grave concern that every day that passes, we're creating more victims in this, not just drug users, but frontline workers. So to get a better sense of how that's playing out.
So thanks through the chair. So Councillor, yeah, what we've done, we have had for a long period of time an employee and family assistance program that provides all of our staff with access to psychological counseling, and people can also access counseling privately and have those costs reimbursed through our extended health plan. What we've put in place now for our firefighters is access to a much higher level of specialized care for occupational stress injury. And that includes the ability for our firefighters to self-refer them to those services. So they don't need to go through any kind of process with our organization. We have, on an expedited basis, where we know we have individuals on staff that are struggling with occupational stress injury, we have proactively reached out to those individuals and connected them with that care. Obviously, these are complex mental injuries, and in some cases, recovery takes a lot of time and requires significant investments with respect to care. So we're committed to doing that. I think with respect to the staff, particularly at Fire Hall 2, obviously the addition of that medic unit, so to spread the demand, particularly at that hall, across a greater number of staff. And Chief Godlington can speak to this. The department has also instituted a program of much quicker rotations of staff through that hall, so less than 12 months, which is quite a bit shorter than what would typically be the case. I think the Chief McCurney, Chief Godlington, and his colleagues have also done a great job of continuing to stay connected with all the staff, particularly the staff at Hall number 2. And I'm happy if Chief Godlington has any additional comments to add to that, so that we are understanding the pressures that they're under. We're working very closely with Local 18 as well to understand their perspectives on this. Very quickly, so all the supports that we're putting in place, we're doing in partnership with the local to make sure that what we're doing makes sense, that it really is hitting the need that the firefighters are identifying themselves. So that's that's our current status, and we'll continue to track the impact of those, both in terms of kind of our rate of occupational stress injury, as well as our ability to get those individuals back to work.
Chief, did you want to add something?
Yeah, there not much to add, Paul, other than there is another program that Vancouver Fire has partnered with Canadian Mental Health Association, and we've just, the city here has invested a substantial amount of money in this partnership, and we just rolled out a Resilient Minds training. It's the first fire department in Canada to move forward with this. We've reached out, and we're also sharing this knowledge with many other departments across the province and the Lower Mainland right now, but as particular for us, the rollout started last week, and within the next 3 months, the entire job, all of our staff will be trained up with the Resilient Minds, which is a 4-step. So identifying, what the mental health, identifying a peer, what the streams in the process are, not just for them and each of their peers they're working with, but then when we come across people in the community as well, of the streams, at how we could play a different role other than just a first response. So, I mean, this is exciting for us to move forward with that as well.
Okay. 2 questions which in my head are related but may or may not be in the methodology of treatment. The number of deaths inside is pretty staggering, so to get a sense of what we're doing on that front. I know we made an allocation in the last funding round, but to get I'd like to know what bigger thoughts we're thinking about that. And then the other one was that the investments in the downtown east side show up as positive impacts on reducing the number of deaths, the west side of the city, and I can sort of intuit why that might be, but I'd like to get a better sense of what the thinking is about why people seem to be surviving overdoses at a better rate there.
Mm-hmm. I don't know if they're surviving overdoses at a better rate. There are deaths occurring throughout the city, and one thing I should have mentioned is that most of the things I talked about, the mobile medical unit, the overdose prevention sites, are in the downtown east side. The naloxone distribution is more broad spread, so that's going everywhere around the city. But we do need to look at other services outside of the downtown east side because the death rate is too high elsewhere in the city. And you saw, I think Paul presented some of the Vancouver Fire Department numbers. It's not just in the downtown east side, so we do need to do more. I can't tell you that the death rate is higher in one place or another because we don't have the granular level data to by residents say within this neighborhood they've had this many of overdose and this number of deaths. So I will say that there are certainly the concentration of both overdoses and deaths has been in the downtown east side to date. The deaths occurring indoors, that's partly because we're doing a much better job in preventing deaths if people are consuming outside of their residence. We've got places they can go, like overdose prevention sites, where 500 or 600 people now are going every day to consume their drugs, or in-site. And there are overdoses occurring there, but nobody's died because people are trained. So the fact now that 90% of the deaths are indoors is partly because if they do go out and go to one of those places, we can save them. The indoor deaths are due to stigma. They're due to the fact that there may not be services nearby in the places where people are residing. Oftentimes we're dealing with very marginalized people in some of our SROs or shelters. So that, I mentioned addiction treatment, our other big focus has to be dealing with reducing the rate of deaths indoors. And that's training staff who work in all SROs, supportive housing, giving them naloxone kits, which we're working on, helping them, and they might need funding to identify places within those buildings where they can encourage residents to come and consume their drugs. I think we can do more in preventing deaths if we do that. And the issue of addressing the stigma of decriminalizing drugs is also important because it might make people more willing to go out to places where they can consume their drugs and be observed in case they overdose.
Thanks very much. Councillor Carr?
Oh, thanks, Mr. Chair. And my thanks to all the staff who are working on this. Really, this, we've all said it, this is just an unbelievable crisis in this city, and I know it's difficult work at all levels to work to mitigate the crisis. And, what I'm hearing very clearly is that it's that we aren't reducing the crisis. We're not mitigating it. We're just managing it. That unless we can get at the moving the illicit drugs which are contaminated out of the picture, all we're doing is managing the situation. So I think that everybody who's, thinking about sending messages to politicians during this particular provincial election and to federal politicians needs to make that very, very clear. We've got to allow the injectable or oral therapies that prevent people from having to take drugs off the street. My questions are around how we manage in a way that doesn't complicate and degrade the lives and risk the lives and the health of the people who are working at this. So I will start with our Vancouver Fire and Rescue Services, around which I have felt very strongly as I think many of you know my brother was a firefighter, so I understand the stresses that go on. And the figures, Mr. Mokri, I just want to get a correction on the figure if I've got them wrong. But it wasn't that Fire Hall 2, the number of overdose calls went up 275% in 2016 over 2015, and then in the first quarter of this year, another 241% over the first quarter last year. Is that?
That's correct.
That's got to make us catch our breaths. So we have a new medic unit. I'm sorry I didn't get the stats on how busy that medic unit is, but I just remember that it sounded like it was already extremely busy. So perhaps you can relay to us what additional resources are we already now thinking we may need if we can only manage and not abate this crisis, and maybe not just in Fire Hall 2, but in other fire halls or in other services that we provide on the street.
There are a number of measures that we're looking at in that regard. And one of the broader issues that we need to consider with respect to the demand on Vancouver Fire and Rescue is their total call load. Chief McKerney and his staff have been doing a lot of work looking at routine medical calls other than overdoses. So these are not emergency medical calls, but routine medical calls that our fire department attends. As you may recall, over the last number of years, BC Ambulance has changed some of their response protocols that downgraded certain call types from emergency to routine. What that has done is increased wait times on scene for many of our crews. We've done some really detailed analysis of those various call types and the impact of our crews on scene. What we're finding is that there is no patient benefit for our crews attending those calls. So we need to do more work on that. We believe, and we'll be coming back to you with a recommendation that fire can discontinue attendance at certain calls, which will free up a significant amount of capacity in the system. So that's one of the things we're looking at, I think, broadly, is are we deploying our fire resources in the most effective way, and including integration with BC Ambulance and BC Emergency Health Services. I think with respect to specifically the downtown east side, as I indicated, our Chief McKerney and his team are continuing to stay very close to that, as well as continuing discussions with Local 18 around the impacts on that hall in particular. We do not have a recommendation at this point in time with respect to any additional net new resources for the department, but we will continue to watch that. Certainly, the overall call volume for the department has gone up significantly and continues to be. This is one driver, but certainly not the only driver. So I think there's a much broader conversation there, Councillor, that, again, we're looking at, and we will want to have that discussion with all of Council over the coming months.
I look forward to that information. I know that we have dedicated money for a full-time position within Vancouver Fire and Rescue Services for mental health support. What's the target date for that position being filled?
We're just working through that competition now, and our hope is that we can have the successful candidate appointed very shortly.
Oh, okay.
So that's very much kind of day-to-day in process.
Great. Thank you. My next question has to do, perhaps it's Dr. Daly that would answer it. Thank you, Mr. Mokri. I was very taken by the figure that you provided of I think it was something like 2,500 people walking into the downtown Eastside Mobile Health Unit, and of those 2,000 were actually seeking support or seeking addictions treatment.
That's right. Yeah, about 2,000 or harm reduction or other services. They weren't there for an overdose.
Right. That's unbelievable. So knowing that you said later, we're not recommending right now addictions therapy or not putting them into detox because there's such high risks that are involved when they leave detox. So what are you recommending that these people do right now?
We are recommending their addictions treatment. What I was referring to was putting them into a detox facility,
right? Okay.
Which some people call for, suggest that might be, should be the immediate course or a treatment bed, because in those facilities they take you off your drugs completely, and you are then discharged. But if you don't have a good follow-up system of care, the rate of relapse is very high for opioid addiction, you're actually at higher risk of overdose death because you've lost your tolerance to the drug. So at the mobile medical unit, we had an addictions physician who could start people on Suboxone treatment when they walked in. That's the kind of model we need. People can't wait for appointments. We've heard this from the police, and I completely agree. If someone's ready at that moment, you don't want to say, well, come back to this clinic and even tomorrow at a certain time we'll get you started. You have to be willing to start. So many of those 2,000 visits were for people starting on Suboxone and then coming back and being monitored. That's the model that we have now at Connections Clinic, where people can walk in there and start on Suboxone. That's the model at the St. Paul's New Addictions Clinic. They are going to be working with the emergency department at the new hub that you've helped fund. People coming in with overdoses, they can be offered treatment immediately. We need to expand that model.
That's great. Thank you.
Thank you. Councillor Ball.
Both of the doctors mentioned the need for a national pain strategy. And I'm just wondering if you could let us know how we could help you in terms of a national pain strategy, and what are you speaking of when you speak for the need? Thank you.
We didn't speak much about this and about the role that people suffering chronic pain and the prescription opioid by physicians might have played in this crisis. And certainly there are some people who are started on opioids for managing chronic pain who then become addicted and may be at risk. You may be aware that the College of Physicians and Surgeons in BC has put out guidelines for physicians about using opioids for chronic pain that advise caution. The problem is that we don't have a lot of other options for people in chronic pain, and that's something we've recognized in Vancouver Coastal Health. Many of our physicians who are expert in management in chronic pain have long been calling for better services for people in chronic pain. There is a clinic at St. Paul's Hospital that really has been overwhelmed. They're one of the few in the province. I can tell you that in our health authority, those physicians have put together proposals that we will be looking at, and we will talk about them with provincial partners to improve that, because you're absolutely right that that is needed. It's one thing to say don't prescribe opioids, but what are the other options available for people? So we need to address that as well.
Thank you very much. Thank you. Thank you. That was my question.
Councillor Affleck.
Yes, sure. Perhaps this fits into that question as well. I'm not sure who to ask, but it's mostly related to data. Dr. Daly, you said there's no granular data that you don't have access to it, or we don't have it, or can you just tell me a bit about that?
The question was about rate of death versus the number of overdoses by neighborhood. So the way we do our emergency department surveillance is it's a bit syndromic. So we're not following up every single patient who comes in. Through our automated emergency department information systems, based on keywords, we can weekly and very real time know the number of people came in for overdoses. We can do analysis going down to by individual level postal code of residence. We've only recently started to get data from the coroner that identifies where the overdoses occurred in our region and who the people are, so that we can start to do some of that more detailed granular analysis. So we haven't done it to date, but that data is now coming. So we'll be able to say, for example, in this neighborhood, we know that there's this number of deaths. We can actually determine if these people were people who were clients of the health authority, Were they in treatment? What went wrong? What can we do better? So that it's taken some time to get the coroner's data at that granular a level. The coroner's done a great job providing data in a timely way. That's starting to flow now, but I don't have that type of analysis yet. You will see it coming in the future.
So the potential then is, while we see, the big focus is on the downtown east side for obvious reasons, but then if you look at the map, there's like the west side and the east side, and it's like these giant neighborhoods, but there could be a 3-block radius that you're seeing significant impacts that we're not dealing with, and then you can potentially do the same kind of thing you're doing in downtown east side and really access that neighborhood.
Yeah, and I should say that even before we've started to look at some of that coroner's data, we've been working very closely with Vancouver Police. They have data certainly on deaths that occur in the health authority, and we've been trying to identify, for example, housing units, SROs, where we may have a large number of deaths, and we've already been getting that data, and we have been responding. So it's not as if we haven't been doing this. We've identified exactly what you said, that we need to identify at a very local level where there might be a hot spot and respond. So we've been starting to get that, but you're absolutely right, we can do more when we get better data.
And the data, SROs, and you could even break it down, are you already to the private facilities and then the ones who are nonprofits? And then
we can identify the specific address working with partners where there may be places where, and we already know this from, we get other reports from the community as well, but that's the goal, to identify very locally where there's a problem and then be able to respond rapidly to that.
To Councillor Ball's question related to the pain thing, but the data, you have all the data on all the any patient in Vancouver or anywhere in the province for that matter. Is there at least something that's happening that's predictable in the kinds of past patients that are overdosing and potentially dying, that it becomes almost more of a communications thing where you can directly communicate with where you're seeing a pattern of people who are overdosing wherever they are, and directly communicate to them about this problem and identify what they should think about, and so that the likelihood of them dying in their homes is lessened?
Well, one thing we started doing right from the beginning of the crisis, anyone who comes into an emergency department who's had an opioid overdose, they are engaged, they're offered to take home naloxone kit and all the information about how to reduce their risk. Go to a supervised consumption site like Inside if they're nearby, an overdose prevention site. Don't inject alone. So we are educating them on a person-by-person basis as they come in for if they suffer an overdose. The other thing we've done the kind of analysis that I think you're talking about to look at those people coming in with serious overdoses in our emergency department. We took a look at those people to determine, are these people who are already known to Vancouver Coastal? Are they involved in our mental health and addictions treatment programs? And actually the vast majority are people we know about. So even though that we know there are thousands of people who aren't on treatment right now, those who've been walking up to the MMU or who would benefit from improved treatment programs, they're not unknown to us. They're just that we haven't had a good system to keep them engaged in treatment, to find the right treatment for them. So we need to do better. This is why we've said we need to focus on our own addiction treatment system. It's serving these people well. These aren't people who've never come to Vancouver Coastal Health facilities. We didn't know about them.
Are you permitted to, even if somebody who hasn't perhaps had an overdose in 5 years and they've been out of the system for 5 years, are you permitted to go and reach out to them directly and say hello, make a call or stop by, or how broad is your mandate to reach out to the potential victims that could?
If they're people who are our own clients or patients, we've talked to our own staff to say, not even those who may come to our community clinics, residential care facilities, if you know there are people who are using illicit drugs, who are your patients or your residents, you need to, yes, reach out to them, have a system in place to reduce their risk. So we are working to be proactive, not just deal with people after they have an overdose. And we had a mandate from Dr. Kendall actually to look at residential care facilities where there may be people at risk and to make sure they have procedures in place to ensure that we can reduce the risk of overdose deaths. So yes, we haven't been proactive. And at all our community clinics, we're doing the same to the staff to say, look, if you know people are at risk, here's what you need to do. And they are doing that.
Thank you.
Thank you. Councillor Stevenson.
Thank you very much, Dr. Daly. Yes, Dr. Daly. Just a personal note. This past week, I did a personal pilgrimage to Vimy and was at the 100th celebration there with Canadians, thousands and thousands of Canadians across Canada. And one of the most primary discussions after talking about the deaths, obviously, in that war was this crisis. And people were very interested in the crisis in Vancouver. It's known now across the country, and people are worried about the implications. So if nothing else, we've been very successful, it seems to me, in heightening this to such a point where people are very, very much aware, and I think that will be helpful as we go forward. I'm wondering about the crisis that we also had in the late 90s and how that compares to what we have now, and were there lessons from the 90s that are applicable at this time?
That's right. The last or the only other declaration of a public health emergency for overdose deaths was in Vancouver in the 90s, and it was localized in Vancouver. That wasn't a province-wide declaration as we've seen this past year, and it was primarily driven not by fentanyl. It was injectable cocaine that was the problem, that was driving very high rates of HIV and overdose deaths in the downtown east side. And it actually prompted a lot of the good services that we now have, like Insight, like expansion and changing the way we distribute needles. We saw success. We saw, and the drug use patterns did change. People, there was less injectable cocaine use, and we did see overdoses come down. Having said that, even before the declaration of this emergency, if you look back historically, there were still hundreds of people dying of illicit drug overdoses in this province every year, and we didn't really talk about it. And that's not acceptable because all these deaths are preventable. So although we did some good things and there were some good services that came out of that crisis in the 90s, which we hope happens again now, I'm hoping that the response that we take, yes, we want to see the overdose deaths come down, but we won't be happy if we get back to a steady state of a few hundred a year. We need to do better than that.
The other area that's already been discussed, and I think is a very important is the stigmatization around this for people. It's analogous in some ways to the early days with AIDS when people were so stigmatized. And I'm wondering if, and we know why, and we know how that's happened, but I'm wondering if you have some examples of people that have died as a result of this that isn't your typical what comes to mind for people, when you talk. If there's some examples that kind of makes us look in a different direction and go, wow, I hadn't realized that.
Well, I don't want to name specific cases, but I will say that one thing I do since this crisis has started is every day I look through the obituaries of the newspaper, and I'm looking for younger people who have died, because most people dying of overdose are in the prime of their life. They're 20 to 50. And if you read obituaries of those people, oftentimes it doesn't say what they died of. People battle cancer, and that's considered heroic. But there's such stigma associated with an overdose death that even families don't want to say sometimes that their family member has died of this. Stigma exists even in professional communities. I'm sure Dr. Jan can talk about this. I was one of our colleagues who did the Salome study at Crosstown Clinic, talked about presenting to some professional colleagues about injectable heroin and hydromorphone. And one of the questions she was asked was, well, don't you want people to get clean? And this question was asked when there were people who participated in that trial sitting on the panel with her. And this idea that addicts are dirty, that they can't talk about opioid addiction as if it's a chronic relapsing health condition that deserves support. We don't speak of people who are addicted to nicotine in that way. We provide them health services. We treat their cancers. We treat the outcomes of their addiction, and we don't treat them in the same way. So it's pervasive. It's not just amongst the general public. I do think we need to remember, and we are very fortunate in Vancouver. We've got a police department that recognizes that addiction is a health issue. We've got politicians who recognize this and want to support us in our response, but there's still more to be done, and that's why I've come to realize that addressing the stigma is so important, even in a place like Vancouver.
Thanks, Councillor Stevenson. Sorry, you're out of time, Councillor Stevenson. Councillor DeGenova.
Thank you very much. Were you going to answer?
I was just going to regretfully announce that I have to catch a plane, so my apologies. I'm going to have to leave it to Dr. Daly.
Thanks very much for coming, Dr. Kendall.
Thank you all very much.
Thanks very much. I'd like to start by thanking our staff and thanking Dr. Daly, Dr. Kendall, our Vancouver Fire and Rescue for being here today and doing so much with so little. A number of excellent questions have been asked, but I'm going to take a bit of a different focus with my question. And the questions that I'm going to ask pertain to more what we're doing. I actually asked these at the last round of our update, but I still hadn't heard back and there wasn't clarity on what we're doing to actually identify the drugs that are coming into the system. So for instance, fentanyl, carfentanil, I understood from the Vancouver Police Department when they answered my question that it could take up to 3 months to test some of these drugs. And then I guess it's difficult to go back and sort of narrow down how they're being distributed and to who and in what areas. So I was hoping that you might be able to answer that for me.
The police might want to answer some of that because a lot of the data we get actually is from Vancouver Police. So the arrival of carfentanil, we found out about that because they tested some drugs found on the scene of one of the overdose deaths. Okay. I can tell you that the coroner does not yet have the capability to test for carfentanil, and it can take some time to get the toxicology results back from deaths to even identify the fentanyl. And there are other what we call contaminants that may come into the system that we don't know about. We are getting some data now, interestingly, from Life Labs, which is a private lab that does have the ability to test for carfentanil in urine of people. And many people who are on addiction treatment get their urine tested regularly to see if they've consumed illicit drugs. So they're now reporting to us on a regular basis the percentage of tests that they get positive for carfentanil. And there are tests primarily in the Lower Mainland. There are people who are testing positive with carfentanil in their urine. These are not people who've passed away. These are people who are actually on treatment. So we know it's out there. Yeah. But I might let the police answer with respect to what, because I know they know a lot more about this than I do, the drugs that might be coming into the system.
I guess what we're seeing from a law enforcement perspective is that a lot of these drugs coming in, you know, there are a vast majority of these opioids are coming in from China. And as quickly as they can be scheduled by the Chinese or outlawed, we're almost seeing new analogs a week or two right after that. So our issue is that we're running into so many new analogs that we can't even find answers as to their relative strength compared to fentanyl or other opioids that are out there right now.
Thank you very much. I'll leave it at that for now.
Thank you. You had a further question, Councillor Ball?
Yes, a question about seniors. Perhaps the doctor could give me some information. I have been asked about, because of the isolation issue with a lot of seniors, that are there treatments that are available for seniors who do have addiction issues and are finding it difficult, especially because of their isolation?
Councillor, I'm not aware that of concerns among the seniors population in particular about access to treatment. I would say that we do have concern about seniors living in isolation who may not access services as they need them, but I can tell you that among the deaths, it's the 20 to 50 age range that is primarily affected. So we're seeing, I don't know what the highest age of death that we've seen, but we're not seeing large numbers among seniors or, interestingly, among youth as well.
Thank you.
Thank you. Mayor Robertson, do you want to make a quick closing comment?
If I may, thank you, Mr. Chair. I just first and foremost wanted to thank Dr. Daly, Dr. Kendall, and the whole health and medical community, and Dr. Jang's certainly been our lead on this in Ottawa last week, addressing the Senate committee, and that's much appreciated. And our staff team, Kathleen, Mary Claire, Chris, Diana, great to have you in the mix. We've had an amazing effort across the board in our first responders, firefighters, and police dealing with this. I know in speaking with the coroner's office as well, Chief Coroner Lapointe, and the pressure that they're under with the morgues being full and just the incredible intensity of this crisis and its impact on the community, I can't be underestimated. And our hearts go out to the many community volunteers and workers in shelters, in our overdose prevention sites, and in SROs, city facilities. There's so many people who have stepped up to save lives and done remarkable work. And I just fear for the burnout, the pressure that so many people are under right now to try and save lives. But I just wanted to express on behalf of our council a huge thanks to everyone for doing your best to take care of people, and a real hope that it's been very frustrating to not see this as the most important issue for the province to solve, and the void of leadership there. I think if this was a natural disaster, a typical health epidemic that had already killed over 1,000 people and was killing people every day, there would be a command center, there would be a czar in charge of ensuring that actions and resources were being deployed urgently, and I can't fathom how this has not become that in BC, with so many people dead and with so much expertise in our health community and among first responders to save lives and get people healthy. I know our addictions and mental health system is not anywhere near as robust as it needs to be, and we've talked about this for many years at this council. Our VPD has raised the lack of treatment and support for people with mental health and addictions as a huge challenge on our streets. So I'm hopeful that this will be an important issue in these weeks ahead as parties vie for our votes and responsibility at a provincial level, because we desperately need to see solutions, and we can't be waiting months and more years. We'll lose hundreds of thousands more people to this preventable death. So I'm hopeful our advocacy and the good work of everyone, all of our partners, will finally bring this to the front and make it the priority that it needs to be for people at the provincial level elected to have the responsibility to keep us all healthy and safe. So thank you very much to everyone for being here.
Thank you, Mayor Robertson, and thanks to those who made those presentations and those who attended to answer other questions. So that takes us now to item 2 on our agenda, the contract award for Vancouver Landfill. Councillor Carr, you had some questions? Sorry, Councillor Carr, here you go.
Thanks, Mr. Chair. Thanks very much. My first question is, if you could just outline for us the challenges, the key challenges in collecting the landfill gas. What is preventing us from collecting more of it?
I think all of the efforts that we've put in over the last little while are geared towards collecting more and more gas. One of the things that we do now is we construct the landfill is we put in gas pipes as we build the various sections. So that captures the gas as early as we can, and we continue to do that as we develop the rest of the site. What we'll be doing with this particular contract is closing off a finished area of the site, which will improve the encapsulation and allow us to collect more gas from there as well.
Okay, so it's a progressively better.
It's a progressive thing, and the challenge we've had in the past is to get the infrastructure in quick enough to collect the gas as it starts to generate early in the digestion process. So with the gas infrastructure going in as we develop the site, every time we put in a 3-meter lift, we put in a layer of gas pipe. So we're collecting it right away, and that's helped us get our percentages quite high now.
Okay. Okay, and what percentage of the landfill gas is still being emitted, and what percentage are we capturing versus is still?
Yeah, so
Mr. Shams, before you answer, Councillor Carr, it's about a procurement, not about the operation of the landfill. Do you have specific questions about the selection of this contractor?
I don't.
Well, would you like to move the recommendations?
I will.
Thank you. Thanks, Mr. Shamus.
Sorry, Mr. Chair.
Yeah.
Mr. City Manager.
If I might just interject for a moment, the closure of this section of the landfill will impact the capture of the gas, and we've been working very, very hard to capture more gas. So I wouldn't mind if we wouldn't mind letting Albert answer that question, because it is pertinent to what we're trying to achieve here, which is earlier closure allows us to capture more of the gas, and that's been something we've really been trying to do more proactively. Could I just give him a moment to speak to that?
Okay. You're upheld on appeal, Mr. Shamus.
okay. So right now we're over 75%. We're running about 76% to date this year, and I'm quite confident we'll be able to maintain it above 75%. As we do more closure, we'll increase the amount that we capture compared to the amount that's generated. So the whole process that we've got in place at the site now is geared towards maximizing our gas recovery.
Thank you.
And if I may, just to build on that, Mr. Chair, sorry, no, we're trying to move on. About 4 years ago, we were at about 30%. So we are now, we've exceeded the provincial mandate for the 75%, and that's been because of these types of investments. So we really want to just acknowledge Council's pushing us to exceed that target. It's a lot of greenhouse gas emissions that are being captured. Thank you.
Plus, it's a great procurement process. Okay, so let's go to the voting screen. All those favor the recommendations, please show. And that passes unanimously. Thank you very much. Okay, item 3 was withdrawn. Item 4, I think Councillor Carr, you had questions on that one too?
I do, thank you.
Okay. Staff ready on that one?
Great. Thank you. More coming in, okay. I'm going to start with a big picture question first. I'm not sure if...
You ready to go, Mr. Roberge?
Maybe Mr. Dobrevoni, you'll want to answer this one.
I'm set up now. It was
fine. Our Greenest City Action Plan goal is to decrease the water consumption 33% over 2006 levels. And to date, we've done 17%. And it's stated in this report that these changes will do another 3%, but it's unlikely we're going to get to that target. What does that mean in terms of the overall goal? Are we going to alter that goal, or are there other kind of major efforts that we could do that they're not in the box right now?
Yeah, so certainly there are things we could do, and both the City of Vancouver and regionally. So for one example, during the summer when we have the dry spell, we go into a water shortage response plan. There's the stage 1 that is automatic. With this year, it'll start for a longer period of time, but then there's a stage 2 and a stage 3, yes, and then a total ban. We could make a decision to keep stage 1 in place, or stage 2 in place all year round. So stage 2 means you're allowed to water your lawns once a week. It means you wouldn't use water for hosing down your driveway. So yes, there's things we could do to accelerate our progress, and those are conversations that are happening at the regional level. If we want to have a stage 0 that's a higher steady state for the whole year. And I'd stop short of saying we're not going to meet our target. We've got a number of initiatives we're bringing forward today. There's many more we're working on. We'll bring those forward shortly and through the year, and we'll get to that harder question: is do we want to miss the target? Do we want to reset the target? Or do we want to ramp it up either as part of the metro region or just Vancouver on its own? Right. We can push harder.
Great. I appreciate that response. That does really fill me in on the bigger picture, and thank you for that. My other questions are very specific to this report. So there was a question that was asked on page 7. Should we grandfather in the non-recirculating uses of water technologies or not? And so I just want to provide a response. I don't think we should grandfather them in, but what would be the reason, or why would you want to grandfather them in?
The only reason to grandfather is looking towards affordability and the impact on the commercial merchants.
Like the dentists?
I'm sorry?
Like the dentists?
Yes.
Okay. Okay, well, I think that we can all take a little bit of a hit to make sure that we move forward. That's just my personal opinion. This is not a council vote on that, but you did ask the question in the report, so I thought I would at least give you my response to it.
Thank you.
A second question is really around the technologies themselves. They are still for sale, the non-recirculating water technologies, right?
It's like the once-through cooling machines, they're still available because it's very simple. You just attach water and you run water through it and you get your cooling. So it's a very simple system. So yeah, they're still available because of their simplicity.
Do you know if the industry is changing in that regard? Is the industry starting to pay attention to the overuse of water, overconsumption?
Yes, there's a lot of the industries are voluntarily doing this work. There was one of in consultation. There was even a manager for the Hyatt Hotel who was surprised to hear they were still legal. He comes from the States, and he was very surprised to hear they were legal.
Does Vancouver have any ability to ban the sale of any particular technologies that don't fit with our policies?
I would.
Water Design Branch. So it's our abilities are through the Vancouver Building Bylaw. So essentially, our recommendations would not allow an installation of that type to be permitted.
Great. I noticed that in the report it talks about there are some buildings, I think it says that we would, it was on what page, but it said we would achieve 0.4% more reduction in water use if the change in plumbing requirements was required for all building types. I didn't understand which building types are not being recommended to be included.
So the recommendations for the building bylaw and the fixture requirements apply to actually all building types. It's those specific fixtures. So they're lavatory faucets and toilets and shower heads.
Okay, so there's no buildings that are exempt?
No.
Okay.
Exactly.
Thanks, Councillor Carr. Councillor Ball?
Yes, thank you. Perhaps you could explain to me who this is going to affect in a large way. Is it a restaurant, a small restaurant that is cooling water for their patrons? Is that going to add to their costs, or how is it going to work? Because I'm not quite sure. I've read the whole report, but I keep getting asked questions about this. How does this affect me from a small business person?
It will affect the food and restaurant industry. Some of them still use once-through cooling to cool food or to help cool their establishment. So it will affect them. In consultation, we found that it's not everyone. A lot of people have already converted to chillers and to more green methods of cooling. But it will have some effect on some business, yes.
And how will we deal with the issues of small business being affected here? How are we going to work with them is what I'm interested in.
We are working with them. I mean, the ban's not immediate. At first, we'll prohibit the use completely, and then it will become in effect on January 1st, 2020, give them sufficient time to convert their equipment.
So there will be some warning in terms of time, because people buy equipment to last for 20 years or 30 years. So it's helpful to know, and I think to be able to plan for what this will actually do to people. And even though we're trying to do good, how are we actually affecting those small businesses over time? So if I could get some help here, that would be.
Councillor, if I may, I also wanted to mention that we have done, there's a positive payback for the retrofit of these systems over the life of the systems that are installed. Okay. In addition, we also spoke with the Restaurant Association, and they were part of our consultation.
Excellent.
And so they're very aware of the changes that we're recommending.
Thank you very much. Thank you.
Thank you, Councillor Ball. Councillor Affleck?
Well, with all due respect, staff, they said the same thing. We heard the same thing about the gas situation with restaurants, and suddenly they realized that the bylaws were changing, and then a whole bunch of things happened. So I'm worried that maybe that the restaurants and small businesses may not be as aware of this. What a percentage of the businesses would have to be retrofit? Do we know how many have already done? What percent? You think about air conditioning on roofs. You think there's endless small businesses with these. And of course, with triple net rentals, the owner will switch the air conditioning or whatever, and then the renters have to pay the fee, right, for the retrofit. Do we have any idea of what percentage are using the required, potential future required system in the city? Is it 20, 30, 40%, 50, 80?
We'd have to get back to you on that. We hired a consultancy to prepare a prevalence study for the extent of these installations across the city. So we have the information. I just don't have that that handy at the moment.
Okay, well, let's use air conditioners as just roughly how many air conditioners would there be in the city that would have to be switched?
The air conditioners wouldn't be touched at this point. They're already electric.
Sorry, okay, so use another, what, one system, the refrigeration systems for restaurants, I mean.
Again, we'd have to come back to you with that information.
Okay, thank you. As noted by Councillor Carr, the grandfather clause, where would that actually, how would that be embedded into the motions? I'm just trying to figure out where that, you'd have to be an F or something, I'm assuming?
We'd have to modify the council report, yes, to add that clause.
Right, so just be a new...
We don't recommend it. We'd like to move forward.
Right.
But we'd have to make an amendment.
Okay, but it would be an addition, I suppose, not embedded in any of the A to E's. Okay.
So it's worth mentioning that in Table 1, we did present the simple payback in terms of how quickly you'd be able to recover your initial capital costs over the life of the appliance.
Right. Okay, thank you.
Is any consolation? Councillor Affleck, my dentist asked me this morning what was going on. I told him, or I tried to tell him, but I was frozen solid, had a mouthful of equipment, but he could barely remember seeing the non-circulating stuff when he was in dental college, so probably most of it's gone, but I don't know about other stuff. Councillor DiGenova.
Thank you. I just had some questions regarding consultation. Does this have an endorsement from, I mean, some of our bigger development industry, I would say that weigh in usually, like UDI? Have you gone to them? Have they endorsed this? Because I see this with changing the, with the way it may affect the, under recommendation B, the Vancouver building bylaws. I'm concerned that it could increase costs, and I thought we were looking towards affordable housing and decreasing costs. So would this actually increase costs? Have you had conversations with them, and have they endorsed this?
Yeah, there would be minimal or no cost impact on the builders, because a lot of the fixtures available at your Rona and your Home Depot, they already meet the national safety code, the plumbing code, sorry. It was issued in 2015. And a lot of the fixtures already meet it anyways. The products, most products you can buy, the vast majority already meet this code.
So has it been endorsed by UDI, and have they been consulted on this? Because they don't buy their stuff at Rona. I'll tell you that.
No, we have spoken to the development community, including UDI, on it, and we actually even offered a specific workshop with them, with their membership. But when the invitation was sent out, the workshop never materialized because of the lack of interest. So, but just by noting that, I think.
But is there an endorsement? Have they written a letter of support for this, as they have for other portions of?
Well, UDI has decided to stay neutral on this subject, and have.
Another question I have is regarding development applications and projects that perhaps are already, for lack of better words, in the hopper that have come forward to council. Will this change things today, or will they be grandfathered in if, for instance, that project hasn't been built, or they're awaiting their rezoning application coming before council? Will they have to make huge changes to their project to comply with this?
So for the changes that we're recommending in the Vancouver building bylaw, they're not going to be taking effect until January 1st of 2018. So any of the procurement that's happened for existing developments, these restrictions, these regulations wouldn't apply to them.
Even if, for instance, they're 18 months out, because we have a number of projects, and I believe right now the city of Vancouver, scaled against Metro Vancouver, it can take 18 months at least to have your project permits go through development and planning. So if it took longer than January, if they had already applied and been approved, then they wouldn't have to comply to this. Is that correct?
What I would say is we work with Development Services, who are the lead group on the building bylaw. So any changes that we make, whether they're these changes to the building bylaw or other changes coming from other parts of the city, that's all coordinated through Kay's group, and those changes would come forward when they bring changes to the so the changes that take place to the Vancouver building bylaw could be widespread in many, and they're all strategically timed to take place at regular intervals.
Will this also, oh, sorry.
So I'm just saying these would be changes along with other changes that are being made to the bylaw that are done periodically. So we're not intending to have this come forward off cycle in any way. Once council decides today, then they would just go into the group of changes that are waiting to go forward with the Vancouver building bylaw when those come forward, and that's January 2018 is when those come up. So developments that are in progress are aware of the changes that take place with the bylaw periodically, and they affect a whole number of different factors for projects.
What if we're looking at single-family residential detached and especially secondary suites? So we're trying to encourage people, incentivize that apparently. I haven't seen very many incentives. We put the fees up and up and up to legalize and have the city license a secondary suite. If you came and tried to do that after January 1st, would this apply to you? And would you then have to make the necessary upgrades as per these recommendations if this is passed?
Yeah, I might answer it this way. Yeah, yes, those projects would be required to meet the Vancouver building bylaw of the day. And so, as I said, there's a number of changes that take place. And this group of changes, I mean, I would summarize these as being fairly straightforward in terms of all the initiatives we have. We think that, as we've showed in Table 1, there's short payback periods. As we've heard, many of the systems out there already meet these requirements in terms of not being recycling. The changes to the bylaw are to be consistent with the 2015 National Building Plumbing Code. And so these are ones that I would frame as being pretty straightforward, because we're talking about the Vancouver Plumbing Code being consistent with the 2015 National Plumbing Code. There's other things that we're looking at and investigating that we'll bring forward relative to Councillor Carr's point to move more quickly and push harder. These aren't them. These are ones that we think are pretty straightforward.
Thank you, Councillor Reimer.
Thanks, Chairperson. I am prepared to move recommendations A through E and to speak to them. So to note that, as maybe to follow up on Mr. Toppervoni's points, these are pretty straightforward and obvious changes to make, which is why Abbotsford, New York City, Edmonton, Maui, the entire CRD, including Metchosin, Oak Bay, View Royal, all of these jurisdictions have managed to do this and not have the sort of hypothetical challenges that Councillor DiGenova put forward befall them. To note that the majority of dentists lease their space and they are on all commercial, are on meters. So this actually is a fantastic way to save money, because you would be paying 83% less for your water, which is why the payback periods are so quick. And to note that it's not just about water, but about impacts on our sewage, because all water that goes through once ends up somewhere, and that somewhere is the City of Vancouver sewers. So in terms of water reduction, use of water being reduced, it is a fantastic program. In terms of more affordability for small business, it's a fantastic program. To note also that one of these pumps consumes as much as 550 single-family homes in the City of Vancouver. We're talking about about 270 pumps overall that would need to be changed. So if this is going to be a big full-on debate, I can't imagine when we get to some of the more significant water-saving things. But we do know from 2015 and the drought that we had that year why this matters. If we could save this much water through relatively simple switch out that also saves people money, I think that it would actually be irresponsible of us not to do it. So I will be voting in favor, and I will not be voting to grandfather. I don't support a recommendation, a consideration from staff to grandfather in something that's so detrimental when there are clear cost-effective solutions available.
Thanks. You'd like to debate this, Councillor Affleck? Okay, go ahead.
Well, I think I know the answer to my question based on what Councillor Reimer just said, but I have an amendment, an addition that I'd like to add, and I'm guessing it's not friendly. So it's to grandfather the current systems. I'm concerned because there's not enough data in this report to provide me the comfort that things like switching boilers and other significant capital costs for small business and for residential homes will not have a serious impact on affordability in the city. I just don't have the data in this report, so I feel it's the responsible thing to do is to add this as an amendment to the motion.
Okay, we'll move to an amendment queue. So Councillor DiGenova, do you want to get on that one? Okay, go ahead.
I'll support the amendment. I think on one hand here, we're looking at affordability in our city, and we've seen, I thought it was amazing that someone from the Renters Advisory Committee didn't even know that secondary suite fees had been increased. Here we're looking at, and as Councillor Affleck's amendment states, that existing systems be grandfathered. Councillor Reimer mentioned that some of my questions included hypothetical situations and scenarios, and I don't feel that they are. I feel that I actually know that, and Ms. Krishna has confirmed this before, the City of Vancouver is the only municipality where a $5,000 renovation or greater will trigger an entire development permit on a single-family residential residence. So with that, and I've gone through it before, you have to go through a green audit process, and I'm concerned that there will be huge cost to individuals who decide to renovate their kitchen or their bathrooms, or as Councillor Louis said before, we want these residences to be safe if they choose to buy a home and change out the knob and tube and that kind of electrical, and that costs more than $5,000. I don't want to trigger something like that. For that reason, for affordability, for small businesses, for residential property owners who are really just trying to get by and some having to defer their taxes, for those reasons, I certainly will support the amendment.
Councillor Carr.
Yes, thank you, Mr. Chair. I will not support the amendment, and you heard me say earlier that I didn't support the grandfathering in, but I just want to really counter the argument being raised by Councillor DiGenova about this being an issue of affordability. In almost every case that I can think of, green initiatives save people money. Councillor Reimer addressed that in this specific case, but in all the energy retrofits, the only retrofits I can think of, or the only changes to the building code that don't in the end save money, are ones that have to do with accessibility, and I know that Councillor DiGenova supports those. So in this case, I think that it's really important we support the greenest initiatives, and water and the accessibility to water will change with climate change. It is changing with climate change. We are finding it harder to secure water in the summer months. It might not happen this summer, but believe me, the way our climate is going, we are going to have wetter, gloomier winters and hotter, drier summers. And there will be issues we have to address. And right now is the time to do it through building code changes I really support. Thank you.
I see you there, Mr. Dorovoli, but I didn't hear anybody ask you a question.
I didn't want to wade into the debate. I just wanted to correct one thing that I heard that was incorrect. The once-through cooling systems are not for residential buildings. They're only for commercial buildings.
Thank you.
It doesn't relate to residential.
Yeah, and okay, Councillor Stevenson, you had something to add here too.
Yes, I also won't be supporting the grandfathering in, and amen to everything that Councillor
Can you just pull the mic over a bit, Councillor Stevenson?
Pardon me?
Just pull the mic a little bit closer.
And amen to everything Councillor Carr said. And I think, Councillor DiGenova, it's not fair to go after one volunteer who's on the Rental Advisory Committee who did a brilliant report.
What's your point of order?
Point two, I didn't go after anyone. I just stated that he did not know. He answered my question. He did not know. That's not going after. That's stating a fact. I didn't go after anyone. Thank you very much.
This is the second time
stated critically, Councillor DiGenova, so I don't find your point of order valid. But why don't we deal with plumbing, Councillor Stevenson?
It was critical, and this is the second time, and that individual
plumbing.
has, pardon me, has done.
Talking about plumbing.
Pardon me?
Well, just let's get on with it. Let's deal with the debate.
That's enough, thanks.
Okay. Thanks very much. So seeing no further speakers, can we go to a voting queue on the amendment, please. Oh, sorry. Everybody has voted, so the amendment fails with Councillors Meggs, Louis, Stevenson, Robertson, Jang, Reimer, and Carr opposed. So now could we please go to the main motion? Sorry, if you got another request. You want to debate the? Okay, Councillor Affleck.
Thank you, Mr. Chair. Well, that's disappointing. I think that my concern is that the report doesn't provide the kind of detail that's necessary for us to make the kind of decision I think is appropriate. I think you look through this list of equipment that will be impacted, and if any of you understood the impact this might have on small business, it is significant potentially into thousands and thousands of dollars for switching this equipment out. If a business is the only business in that building and it's a triple net, that cost will be borne by that one business only, and this, of course, will be restaurants if it's in the business. If for other equipment, including perhaps baptism fountains and baptismal fountains. And Councillor Stevenson's left the room, but I'm not sure if that what impact that will have. But I think it's crucial that when we make decisions, we have to think about the big picture and the complete and look at affordability in the city. And I think that given that there is not enough data in this package to provide me the confidence that this will not have a serious impact on several types of businesses in the city, then I cannot support this. Thank you.
Councillor DeGenova.
I'd like to echo some of those comments as well. I'm concerned with affordability. I'm also concerned, I've seen UDI support several parts of the Greenest City Action Plan and the building plans here. And the fact that they've decided to remain neutral, I'm not saying that that means they don't support this, but I'm concerned that they haven't endorsed this, especially considering, I mean, many of the small businesses, including restaurants, will be affected by this. I mean, I think they're already up in arms considering the city of Vancouver has a goal to ban natural gas in less than 3 years. So for that reason, I think that it's difficult to make decisions.
Councillor DeGenova, we really want to focus on the plumbing, okay, and this particular report.
I am focusing on the plumbing. You know, if you live in a residence with plumbing, but you don't have heat and electricity, it all comes together when you look at buildings, when you look at residences. And I'm also concerned, this may not now apply to residences, but in the future it could apply to larger buildings, just as we've seen other buildings be affected. But, you know, I just kind of look down the garden path here. So for those reasons, I won't be supporting this, because on one hand, I hear many of my colleagues here put affordability first, and then when we come to motions like this, it goes out the window. So for those reasons, I can't support that.
Councillor Reimer.
Yeah, just to close, although once again, I feel like I'm sort of stuck in this fact check role on some of the erroneous or unintentionally stated misinformation. First off and foremost, there is no plan to ban natural gas, either 6 years from now or any time from now. So just to clarify that one more time. On this item, I do think, and I feel that staff perhaps unintentionally have been denigrated a bit in what is in fact quite a robust effort, as noted on a fairly straightforward policy proposal that most other cities and municipalities, small towns, and rural areas of North America have undertaken already. So I do commend you for the 6-page summary on public consultation. If one were to read it, they would note that it's an extraordinarily comprehensive consultation of those affected, particularly given that we're talking about less appliances than we were talking about deaths in the overdose crisis in the previous item that are going to be affected by sections of this. To say that I found the 10 pages of summary in the report about the financial impacts on all of the possible businesses, given the relatively small numbers we're talking about, very helpful. And it gave me great comfort to know that the kinds of positive impacts we could be making both on water conservation, but also affordability, because water is metered, so it is a direct cost every liter that is saved. So to see that moving forward is really positive. All of this, though, this whole debate has reminded me what our biggest challenge is with water, and that is living in a rainforest after feels like forever since it started raining in the fall. It is very challenging for people, even sitting at council tables, to wrap their head around the very significant challenges that Vancouver faces on both water access, but also the infrastructure impacts of wanton and unregulated water usage. So I appreciate the work you've done. I am very much understanding the challenge you have ahead of you, and anything that we can do to make sure that the factual record is accurate, please let us know, and we'll make sure that it is.
Councillor Reimers, so I think we're ready to go to the vote. Madam Clerk, if you'll put up the voting screen, please. So please indicate. Recommendation. So that passes with Councillors Affleck and DeGenova opposed. Okay, we'll try to briefly deal with the item 5. City sponsorship of mass participation cycling events, and I believe you had questions for staff, Councillor DeGenova. Are you ready to field these, Mr. DeGenova? Or sorry, Mr. Dobrovolny? Okay. Councillor DeGenova?
I'm ready. I'm not sure if this is a question for Mr. Dobrovolny or for another staff member, but I'm curious as to know why this isn't being funded under the sports hosting grant or some other avenue. I just don't see a lot of events in the city funded under engineering services. So if you could explain that, I'm just really concerned. We've heard about how much money we need to deal with the opioid crisis this morning if it's not coming from another event budget, and we're charging others for events of this size. I'm just curious to know as to why that pocket of the budget.
I'll ask Margaret Wickens is our Director of Public Space and Street Use. I just want to stress that we work very closely with our legal department and our procurement department on determining the process for moving it forward. And maybe Margaret, if you want to add some information on why a sponsorship avenue, which is a little bit unusual.
Thank you. So the proposals for the mass bike events that have come forward to us came as unsolicited proposals. And so we consulted with procurement as well as legal on the best process to explore in terms of how best to treat that within city processes. And in considering their proposals and the nature of the partnership proposed, their recommendation was that this is a sponsorship as it helps us to achieve identified city objectives that are within Transport 2040. Specifically to host mass participation cycling events such as these, and also that the city stands to gain significant benefit from the launching of these mass participation events. So the recommendation was that it be pursued as a sponsorship, and as it's consistent with a number of objectives that are within Transportation 2040, engineering staff recommended that it be taken forward.
And as a sponsorship...
Mr. Chair, can I jump in? Just as I'm not sure we've answered the question, which is why is this not sport hosting and why is this in engineering? I think that's kind of the way I heard the question. And I guess what I would highlight is that through Viva Vancouver, we do a ton of activity through engineering to activate the public realm. And we talked about those at council about a month ago. All sorts of activations, from yoga in the street to the pocket parks, the streeteries that we're piloting. This is an initiative to activate the public realm. And the idea here is, as we've seen in cities across the world, that streets are not only used for driving cars on, they can be used for festivities, celebrations, walking, cycling, music on the side of the road for these types of activities. And so this really falls into that Viva bucket of ways to activate the public realm, which is why you're seeing it there. Not through the format of the sport hosting, which is larger sport, like largely competitive sporting events, which this is not. This is more of a large street festival.
Okay.
That's why it's through that track.
Yeah, unlike the Grand Fondo or the Gastown Grand Prix that are competitive events, this is a celebration of cycling and family-oriented.
It just mentions that they're also organizers here. So I wasn't quite sure why that would come out of that pocket in this. Also, I understand that this is included in the 2017 approved engineering service operating budget, and I know that we didn't even have enough money for snow removal last year, and we had to increase that considering the difficult winter we had. Would we be looking at diminished services in other areas to support this, and was this planned in the budget, or is this now being requested from that 2017 engineering services operating budget? I couldn't find this as a line item in the budget last night when I looked back.
Yeah, no, this was not a line item that was originally contained in the budget. These were two unsolicited proposals that came to us that we feel have merit. I should just clarify that the snow fight was funded as per our existing policy, which is a portion of it is funded from our budget and a portion of it is funded from contingency and other uses. Within the engineering budget, we have opportunities to allocate funding through the course of the year. We bring that through to council or at the staff level, depending on the funding levels in our city policies. And so this is something we're able to fund within our existing engineering budget, but it came up through the course of the year because it was an unsolicited proposal that we feel has a lot of merit to support and is consistent with our Transportation 2040 goals and objectives, and in fact is specifically identified in our Transportation 2040. We just weren't prepared necessarily to move forward this year, but when we saw these two proposals come, we thought they have merit and would allow us to treat them as pilots and learn from them and help shape future programs.
Okay, thank you.
Thanks. Before we go ahead, we would normally pause at noon, but I think there's some interest in trying to complete this item. So if I could have a motion to extend until the completion of this item, and then we'll recess to go in camera. Is that acceptable to council? Okay, so thank you very much. Councillor Carr, you can begin.
Thanks very much, Mr. Chair, and thank you for all the answers because you've answered all my questions except one, and that is, is there no grant program that was appropriate and that's why it's through engineering? I just was wondering why, and in the $250,000 it does talk about sponsorship funding and in-kind services. Do we have a breakdown of that, and what does sponsorship funding mean?
Yeah, so one of the key differences with sponsorships and grants are typically given to an agency that goes separately and does what they do, whereas with the sponsorship, it's more of a partnership between us and the organizers, with us having an ability to shape and work with them on the end result. And so that was part of the process we went through with law and with procurement to determine if it was a grant, because structurally we have two different processes, grant versus sponsorship. Because this is more of a partnership, it allows us to have input and shape the ultimate event. Then it was deemed to be more appropriate in the sponsorship.
Thank you. That explains the sponsorship part of it for me. Do we have an anticipated breakdown of how much would be the city sponsoring via cash versus the city sponsoring versus in-kind services?
Yeah, I mean, the high-level answer to that is much of the cost is in-kind for, and largely engineering and or police. We're still in the planning stages with the organizers, so we don't have a specific detailed breakdown, but we're confident of the overall cost because so much of them are in-kind engineering and police. I don't know if there's more to add, but that. Yeah, and traffic operations.
Right. Great. Thank you.
Thank you. Councillor Affleck.
Thank you, Mr. Chair. Just a couple of extra questions. Those were also my questions, but the investing in events, we do this all the time. What other events where we've seen this kind of significant one-time investment? This is at this level in the recent years. Are there other events that we've made this kind of commitment?
Well, not directly with engineering. I mean, celebration
the
of
city.
lights and celebration of lights are some of the New Year's Eve are some of the big events that we have sponsored. Lunar Festival, Pride are the big city events that are we're connected with. As I said, this is two, and part of this sponsorship relationship is for us to work with them to help shape it. The intent being both from a city priority, but also from the event organizers, is to make these ongoing events that become signature events. And so it is important for us to treat this as a pilot and do some real learning and see how they can grow. And also, as I mentioned earlier, because it's part of our Transportation 2040 priorities and fits well, we'd be looking at how we formalize a process like this to a larger scale in future years.
And there's no discussion to combine them into one big event? I mean, right now they're just two events. Are they looking at working together to create one really big sort of event?
Yeah, we had that discussion. The two events have different personalities, strategies, and targets. One's in the evening and similar to events in Quebec, and the other one is intended, I think, to be part of a larger series of events in cities other than Vancouver, but with Vancouver being the key signature location. The event organizers are here as well. I don't know if there's an interest in having more questions, but I think the two events are evolving into different types of events, and we feel there's value to pursue both and learn from both. Like I said, one is a night ride, and the other one is a downtown-centered daytime ride.
And in general, when we hold these kinds of events, or we partner, or even when we don't partner, the return on investment and the impact on the city, do we have a valuation on that we can sort of assess? Like, for example, New Year's, what's the value of that for the city? Do we have any understanding of that?
Certainly, as we determine the terms of the sponsorship agreement, the kind of reporting and kind of measures of success is something that we would want to pin down through that sponsorship agreement. In considering the best way forward in treating these unsolicited proposals, an important consideration as well is the value for money. And in this case, because the majority of the sponsorship costs are city costs that are well understood, we feel confident that there is kind of value there that we can be reasonably assured of. Also, we're seeing these as pilots, and so what we learn from these events, as well as the reporting that comes from them, will help us learn in terms of how we take support going forward.
Often there's a multiplier that we talk about, certainly in the arts and culture community. I think it's 12. I think is the multiplier or something on the costs. Is there some similar numbers that we could say for this then?
I don't know that we have a specific answer to that in terms of the economic multiplier that it generates. We know that for these events, they're also looking at sponsorship money, external sponsorship money beyond what the city's providing. And that's something we can take away, is to say, ask how we can quantify that.
Yeah, I do have one question for the organizers, if they're willing, just regarding, because this is a one-time commitment, so I'm not sure, Mr. Chair, who might be the person, or Mr. Albavoni, who might be the person that, the confidence, any one of the organizers and their confidence in that this will only be a one-time commitment. Do you want to go up to
Okay, you'll have to go to the mic.
Can I make a suggestion?
Yeah.
Council? Rather than put them on the spot to answer it, maybe what I can do is, in the past, New Year's Eve is a great example. We had intended to have a one-time commitment. The event was hugely successful and much larger attendance than we had expected, and we did come back to council for a second year with a smaller request to really help the event to launch. So it's our intention that this would be a one-time event. If it's wildly successful and they want to do a second year or a third year and a fourth year, but they do need some small amount to keep it going, we would want to come back to council and have that conversation. So that's our intention, and that's the conversation we've had with the organizers. But at this point, we wouldn't want to commit that we're not going to be a part of it in the future. It may be wildly successful and there's a desire to expand it or to have different role that the city would play, but our intention is to get it kicked off this year and to see where it goes. And we'll come back and have a conversation with council about how well it's received and whether it would warrant additional investment.
Those would be future council decisions.
Okay, thank you. Thanks.
Thanks, Councillor Affleck. Councillor Ball?
Yes, thank you. I know that many of us participated in the Dutch ride at one level or another, and I noticed how it managed to go off without a hitch in terms of public perception and working with the public. I know in the past that sometimes a critical ride got very difficult for people who were trying to get to doctor's appointments or hospitals, and is that one of the reasons why we're trying to embrace the festival in a way so that we can make sure that it works for everyone and still is successful? Is that what we're trying to do here?
Yeah, the critical mass ride was certainly, it had different intentions. It was not on a pre-scheduled route and was not managed, with city staff. And this is the exact opposite. This is intended to be more like a run, that we have a route that's well marked, well publicized, well managed, and we'll be doing everything we can to minimize impacts. This event wouldn't be without impacts. It's in the downtown, it's around Falls Creek, but certainly the planning that the organizers are doing, and also Sandy and her team in film and special events, that's the whole focus of their work, is to minimize impacts and have it go off, I think in your words, without a hitch.
And we'll be informing the public long before that this
Yes, absolutely.
fun thing is happening and they can participate or not participate.
Absolutely.
But there will be alternative routes to get to where they need to go.
Yes, absolutely.
Great. Thank you very much. Thank you.
Thank you. Mayor Robertson?
Yeah, I'm prepared to move the recommendations if there's no further questions.
Okay, you want to debate that, Councillor Affleck? He did. There are no further, you don't have any further questions, do you? No. Do you have questions, Councillor, Mayor Robertson?
No questions, no, just
Okay,
ready to move a
so
motion.
he's moved the motion. Did you want to debate it? Yep.
I'd
Okay,
like
away
to
we go.
speak,
Oh, you
I'd
want
like
to speak
to
first?
it? Yes, please.
Okay.
Thank you. Thank you, Mr. Chair. First, thanks to staff for bringing this forward, and to the organizers of our city ride and Bike the Night, the two proposed big rides, which is exciting. We've had rides last year that these organizers put together that were successful forays into this, but it's interesting how Vancouver is a leading city for cycling in North America right now, but we don't have big signature rides for people of all ages and abilities. We have some great races here, from the Grand Fondo to the Gastown Grand Prix. Both are on the map for cycling and the community that races. But unlike many big cities, from Montreal to London and well beyond, we don't have big rides for people to do as recreation. And lots of people are learning how to ride bikes. Lots of kids are learning to ride bikes in the city. We're seeing extraordinary increase in women riding bikes since we started improving the bike network. So I think we've got a lot of desire out there to do rides like this. We need to create bigger opportunities to do that. So I appreciate all the work of the organizers and staff to put this pilot proposal together to get us going on it. I fully expect these will be big successes and will grow over the years to come. I won't be surprised if they become very big and popular rides that bring people from all over to cycle through Vancouver, which is a real treat when it can be done just as with the Sun Run and other big walks and runs that people do for fun, to raise money, for recreation. Not so much for the race component, but more for the social and the beneficial side in the community. And that's would love to see more of that available to people who want to jump on bikes and do it. So I think it's a good next step. Appreciate the work that's gone into pulling it together, and we'll look forward to many other sponsors jumping on and being part of this and helping it grow. Thanks.
Councillor Affleck?
Thank you, Mr. Chair. Well, contrary to popular opinion, I don't hate bikes. In fact, I was at Canadian Tire last year with my kids, and I was buying some bikes. And 3 different people came up to me and said, "Whoa, wow, George Affleck in the bike section. What the heck is going on?" I own a bike. I ride a bike. It's true. But you know, so what I do love is opportunities for us in the city to have fun and to celebrate whatever it is that we do in our day-to-day lives. I was the New Year's Eve celebration came from a motion of mine a few years ago. It was something that I believed was missing in the city, and we had full support of that. And there was a startup cost, and as the city manager has mentioned, that there was continued funding because of the success of it. It's a good investment. It draws attention to the city for tourism, for having fun. This whole no fun city, we got to stop that. I think these kind of events, if they're controlled and they're friendly and family friendly, are very positive for our city on so many levels. So I will support this and look forward to attending them. Thank you.
Wow. Councillor Reimer.
Can we move that amendment right now? Yeah, I support it. I did, though, want to add just a vote on the mass participation side, because I think there were some questions earlier about why is this engineering. To me, this is a big opportunity for us to get together in ways we don't always have the space to. It happens to include cycling, but it could include, as Councillor Affleck said, any number of things, and it would be worth supporting. So I'm looking forward to it. I've had the pleasure of being in Bogota for the cyclovia, and it is really, in a city that is about 85% low income, it is amazing to see what providing people with public space they live in small spaces, and having that public space to be able to celebrate community, to do things you can't do in smaller indoor spaces is pretty exciting. So, and if it involves watching Councillor Jang and Affleck lead a cycling ride, then that'll make it even more interesting. Thanks.
I doubt if Councillor Jang's ever been accosted at Canadian Tire by people surprised that he was buying bicycles. Councillor Louis.
I don't believe that Councillor Jang will make it to the front of that pack. But that's a challenge for you, Councillor Jang. Order.
Please speak to the motion. Speak to the motion.
I can't believe that Councillor Affleck bought some bikes at Canadian Tire. There's some really good bike stores in Vancouver. Let me say that I love bikes. I have 5 of them. So, and if you want to borrow a bike, Councillor Jang, you'll fit my bike.
Okay. Keep going, Councillor.
So I was also had the opportunity to be in Bogota for Cyclovia and be in Montreal for their weekends events as well. And this is, I've seen firsthand how impactful it is for the community when there's a range of ages, a range of people from different economic backgrounds. And the range of bikes is amazing. Some of them are real nice bikes. Some of them are real pieces of junk, but they still come out. And it's not about so much the bikes that we're talking about, but rather it's a sense of community and getting people out of the house and building the communities that we want. And this is an opportunity for us to do exactly that. And so I think this is an opportunity that we should grow. I hope that it's successful and that next year you come back and give us some really good news that we can grow this as an opportunity. I hope, like the New Year's celebration, that come back and ask less money. But let's, depending on the results, I think it's well worth its investment because we like to pride ourselves as a healthy city, fun city, as Councillor Affleck talked about a little bit. But it goes much more than that. So I'm very pleased to be supportive of this, and hopefully many more years to come as well.
Councillor Genova.
Thanks very much. I was concerned with the funding because I've recently seen a number of pictures, perhaps people just not feeling that their streets are kept up to what they'd like to be. I know that our engineering department does all that they can, but I've received some emails of concern from residents that, well, is this going to dip into the budget of making sure that sort of the lawns are manicured outside of my property and in public spaces and areas itself. So I'm glad to know that that's not the case. And I suppose if engineering feels that this dips too far into their budget, they'll come back to us and ask us to be innovative and give them money from the innovation fund or something to finish up with the streets. So for that reason, and as a park board commissioner, a former park board commissioner, and as a city councilor, I think it's very important to have a number of free, low barrier events here in the city of Vancouver. And I think that for all of the reasons that have already been mentioned, I'd like to amend this to say that I'll support it if Councillor Affleck and Councillor Jang ride on a tandem bike together, just because I'd like to see that. But I won't. I'm still hoping for it. But I certainly will support this. And I'd like to thank everyone from our events team, engineering, as well as those who've supported the event and have worked so hard to bring it to us here at the City of Vancouver. So thank you. And for those reasons, I will support it.
Councillor Stevenson.
Thanks very much. I'll also support it. I'm feeling a little thrown under the bus here, though, because it has been always Councillor Jang and I that have participated in these bike rides and had photos, and we've both gone out and got our spandex outfit.
That's why I didn't include you.
So, I actually do own a bike, unlike Councillor Jang, and I actually do, from time to time, ride that bike. But I'm, of course, very supportive of this and will vote accordingly.
Thank you, Councillor Carr.
Yes, thanks. Well, I think it will be unanimous at this table. From what I'm hearing, I'm certainly happy to support the proposal here and really thank those who brought forward the ideas to the city and thank our staff in engineering for the collaboration that will ensue. I think from a public concern perspective, I think people should know that having an event like this co-managed, from organizations with the city, it really points to how well managed it will be. And people embrace the various kinds of events we have in the city. I think very particularly of the Sun Run, which has really engaged families in a healthy outdoor activity. And in part of the city, it's gorgeous and it's fun for people. And I look at these particular two events as very similar to that. That it's an engaging, family-oriented, well-managed, as Councillor Ball pointed out with her questions, one that the public will know well in advance the details of regarding the route so that they can plan their days accordingly. So for those reasons, I'm excited about supporting these particular events.
Okay, seeing no further speakers, we'll go to a voting queue. All those in favor, please show, and contrary as well. So that looks like it passes. Councillor Stevenson, did you have a technical? There we go. Okay, all in favor? It's unanimous. Thanks very much. So we'll recess for 1 hour to go in camera till 1:15. Yeah, we do. Okay, everybody, we do have quorum, and I know some of our speakers would like to get on to something else. So if we could just resume here, I'll call the meeting back to order. The next item is item 6, community services and other social grants. I don't think there's any staff presentation, no. And so I think it would be best if council is agreeable to go straight to speakers, some of whom have been waiting all morning. I just want to ask Ms. Elliott Buckley, are you okay to continue in your current spot, which is 4th, or did you need to go to the top of the queue or ask to? So you're fine with speaking in the current order, eh? Okay, great, thanks. Okay, so our first speaker is Mr. Kevin Barlow from the Aboriginal Executive Council. Welcome, Mr. Barlow. I think you know the routine.
Good afternoon, Council. I thank you for this opportunity to speak to there's a double recommendation, and in my dealings with the staff, city staff, one of the things I've made clear is that our agency is often called upon to get involved in various processes. For example, we're on the Healthy City for All and then we've been involved recently with the opioid crisis response and that type of thing. And it's quite taxing on our agency because we don't have any funding beyond year to year. And in recent months, we got involved with the Aboriginal Front Door Society, which is in the downtown east side, and we're trying to help build their capacity, and that has also added to the burdens of that I've experienced at my office. These are all important things, and we would have to be involved with them anyway, but it certainly helps when there's some resources to have staffing in place. And an example I can give you is this past fiscal year, we were successful in getting a number of different grants from various levels, and we were able to get 8 staff, which is the highest staffing level that MVAC has ever had. But last Friday, March 31st, 5 of those people are gone, and in another month, 1 more person is gone because it's the nature of the funding. So the investment that the city makes to MVAC, even though it's additional resources, and I know there are a lot of important requests that have come in, and I don't envy you the decision of trying to sort through all that. However, I can tell you that it's a really important element for us to have some kind of stable base of funding so that we can partner with the municipal, provincial, and federal governments and the private sector, included, to try and make the impact that we want to have. For example, we're now adopting a collective impact approach, and we're trying to find a way of getting all the stakeholders together to make sure that we can identify what a common agenda would be and how to work toward that. And our first conference was held where we identified both housing and homelessness, as well as increasing education, training, and employment outcomes as being our common agenda. We feel by addressing those 2 main yet major areas, we can sort of hit a home run and have influences in the other sectors, like reducing the number of children in care and getting people out of poverty and having better health and all these kind of things. We continue to work hard to try and make our issues known for the urban Aboriginal population, which we feel has now grown to be about 70,000 people in Metro Vancouver, and there's a lot of needs, but yet there's a lot of successes too. We have a significant number of people that are gainfully employed working at UBC and the city and different places, but unfortunately there's still a big number of people in our community that are living on the streets and experiencing a lot of number of issues like mental health and substance issues. So even though we have some good stories, there's a lot of issues yet to be resolved, and an example I can tell you about how the city has really played a leadership role was that recently the federal government has announced the renewal of the urban indigenous strategy. And a lot of the recommendations that came from city staff through various consultation processes and also from our community and across the country was that agencies like ours need core funding. And so the federal government did respond by saying that they're going to issue a call for core funding for up to 5 years. And so that's the type of thing, you know, when we get together and work with our partners, we can close these gaps, and then we don't have to worry about the funding so much, and we can deal with the issues and really trying to make an impact. And I think that's really important. And one of the people that was going to speak here later, but she had to leave, was Mabrat Bain with the Wish Drop-In Center. We have a partnership with them even dealing with sex work and funding from the Public Safety of Canada to try and help sex workers exit or transition out of the sex industry. And we need, you know, these kind of resources to keep those kind of partnerships together. So I see it's flashing here, and I've probably reached my limit. So thank you very much.
Well, we're not done with you. We're not done with you, Kevin. We've got a question from Councillor Reimer and then from Councillor Carr. So you do have some questions. Sorry.
Thanks for coming today, and thanks for, I know you're very, very, very busy, as many of the nonprofit leaders are in the community, so thanks for the time today. My question was actually on the federal funding. I know we could probably have a long discussion about some of the policy promises that haven't materialized yet, but I'm more interested in the funding and whether that's coming to the frontline services.
There's 4 streams that they've announced. One is basically core funding. They're calling it capacity, organizational capacity. And that's going to be released in about another 2 to 3 weeks. And then they said it has to be out there for at least a few weeks for people to apply. There's one on research and innovation, but that's going to come out next year. And there's another one, I should have had that available, but there's 4 streams in all. 2 are coming out next year and 2 are coming out this year. The other one is programs and services. So yes, frontline agencies can apply to this just like they used to under the Urban Partnerships Program, but the Urban Partnerships Program is no longer in existence. So the Friendship Centers will get their own pot of funding like they always have, and the Métis will get the economic development funds they've always had under the Urban Aboriginal Strategy, but there's a whole other group that is going to bunch of groups that will be applying under these other funds. And I think one of the elements that they're really encouraging in the next round of funds there is these coalitions like MVAC, because they feel that it's a good way of reaching into a community, getting all the urban indigenous stakeholders together and having them respond like as a collective. And so right now we're trying to form a national organization, the Canadian Indigenous Executive Network, and there's 4 coalitions here in Vancouver, Ottawa, Toronto, and Winnipeg, who will probably become the founding members. And as people succeed with the funding call, other coalitions will pop up and become part of that. And so when we met with INAC and told them that this is one of the things that we feel is a best practice model. And Vancouver, as you know, we've been in existence since 2008 and incorporated in 2009. I think they really like that model, and that's why they included that as one of the funding criteria.
Yeah, well, I was realizing as you were talking, when MVAC came together, it was the last time we had a Liberal government because they saw the benefit of this hub, and then the government changed, and it's been a decade of no funding for it.
Yeah.
Okay, well, that's good to hear. I appreciate it's challenging to get programs back up and running, so it's good to hear that the money might be flowing in the next few months.
Yeah.
I did, too, want to thank you very much for MVAC's willingness to take on being the bridge between the city and Aboriginal Front Door. The services are, I know you know, they're just so critical, and I know you've got a lot to do, so I appreciate you extending a little further to make it happen.
Yeah, for sure. Thank you.
Okay, thanks.
Thank you. You got questions for Councillor Carr as well.
Yes.
Thank you so much. I really appreciate you not only being here, Mr. Barlow, but all the work that you and your organization do and your role in supporting and being involved in our advisory committees. It's awesome. So you are getting a grant this year, and my understanding from listening to you is that ongoing sustained funding is really critical. We don't have those kinds of grants necessarily here, but I'm assuming that you are in conversation with our staff who can be supportive in, it sounds like you've already got some ideas out there, but you are, I'm assuming, having conversations that look to where you can find that sustaining funding.
Yes, for sure. I think the federal government has always been our largest chunk of funding.
Right.
So the urban indigenous strategy, we will pursue that. And if we are successful, then it's a 5-year block of funding, which will be the first time I think we've ever had that kind of stability. And it's kind of ironic that we were called in to help the Aboriginal Front Door Society, but 2 of their funding pots are 3 years and 5 years, and ours are year to year. So I don't know who is helping who, but they seem to be in a better financial situation. So that will be certainly one. The other one, and it's unfortunate that the province here, with the Ministry of Aboriginal Relations and Reconciliation, they roll out their funding in September. And the year before, we got funding from them in February, and despite my efforts to try and get them to see if there was any way they could look at multi-year or rolling it out earlier in the fiscal year, they just said their system is such that they can't do that, that they have to request funds from different departments within the province, and that's how they get their budget. So I'm glad there's an election, because certainly any of those candidates will be hearing my views on that, and I think this is an example too where the feds and the municipal governments here can also raise those issues with the province and say, why aren't they responding in a more proactive way and having funding, like, instead of half of the year, like, a full year. And I think they can do that. They can find ways of, rolling those dollars out in a multi-year agreement. So, but here with the city, certainly we're stepping up to try and respond to the opioid crisis. I think I saw figures last year that out of the 900 cases, that there 254 were Aboriginal, but the coroner's office is not collecting that information. I consider that a low number. I think it's higher. And so we want to get involved to see if there's any way we can dig deeper and find out just how it's affecting the Aboriginal population, so that we can design better interventions. And we've been impressing upon Vancouver Coastal Health for a year and a half now about the funds they used to have under the Haywonook organization, which folded. And some of those services have been redistributed elsewhere, but the addiction services have not. And so here we have this crisis, and it's certainly addiction related, and they're not having those dollars out in the community. So we've requested another meeting with VCH, both Patty Daly and Leslie Bonshore, to make sure that they hear the concerns of the community, because, I believe there's a lot of underlying core issues that we still need to dig deep and look at. And that's why my office even is trying to look at understanding the psychology of poverty, because it's not so much that somebody's poor. It's sometimes that they've come from multi-generations of poverty, and there's certain things that are ingrained, and it's hard to have that self-worth and to feel that you can accomplish going into college or university and succeeding. And so there's a lot of additional supports that need to happen. And then, the Native Education College, which is a member of ours, I think they have 200 to 300 students, and they said, after Christmas break, when people go home for the Christmas break, there's, almost like 100 that don't come back because of financial and other implications. And that's the thing that we want to change, so that we can find better supports, even get the private sector involved, so that, additional supports can be there. We have single parent homes, and so we need to find out how we can support them. And I think that's what the Wish Drop-In Center was going to talk about, was, how there's such a critical need for services for women, and certainly Indigenous women especially. I think there's a lot of issues that we have to figure out, violence against women, poverty, single-parent homes, and all these kind of things.
And homelessness as well. I mean, I was out doing the homeless count, and there was more First Nations people than I've ever experienced in the 6 years I've been doing it. And I think the statistics are showing that. So Thank you for your involvement on those critical issues like the opioid crisis, and I think too on the homelessness issue. It's very important. So thank you very much for being here and for your work.
Thanks very much, Mr. Barlow. That's all your questions. David McIntyre.
Good afternoon.
Welcome.
I had an opportunity to go for lunch today, and it highlights on a cold and rainy day the importance of the decisions that you folks are making today, as well as recommendations from city staff. Thank you to Mayor and Council for the opportunity to raise our concerns and highlight the very negative impact the staff recommendation of removing supports for people with mental illness on and homeless people on the west side of Vancouver. I'm David McIntyre. I'm the Executive Director of MPA Society, an agency with over 46 years of providing supports and services to people who are mentally ill and homeless in the city of Vancouver. As outlined in my April 7th email to City Council, MPA Society operates the primary mental health and homelessness service on the west side of Vancouver, located at 2275 First Street. MPA operates both supported housing as well as a resource center that is integral to providing supports and services to the most vulnerable residents and homeless people in the area and throughout Vancouver. Each day the program supports on average 90 individuals from the local community, providing mental health services, supports, a food program, food bank, and daily structured activities. 100% of the individuals have a mental illness or a diagnosis of a mental illness. The majority of attendees are either were homeless or are at risk of losing their housing, and the majority live with addiction. And I can tell you we have seen the impact of the opiate crisis. We are grateful to the City of Vancouver for your past support in providing MPA with an annual grant of $16,500 to support the coordinator of social programming position, who plays a significant role in providing programming for individuals with mental illness, but who also liaises closely with local businesses and residents to assist the community integration and strengthen community connections. The impact of this role is obvious through the positive relationship MPA has with the local community. The effect is strong community support, awareness, and engagement, as well as reducing concerns from local neighbors regarding the program and the people who access the supports. The position also supports a number of initiatives of the City of Vancouver, including Homeless Action Week, and supports the city priorities including inclusivity, healthy and active communities, and food security, as well as fostering partnerships with the local community. We were informed without consultation that the City of Vancouver will be cutting funding for this position and effectively reducing much-needed services to Vancouver's most vulnerable citizens and the homeless. In fact, this is the only funding MPA Society, the key mental health service provider in the area, receives from the City of Vancouver. As a result of this perhaps ill-informed decision, MPA will suffer a funding shortfall and may actually have to cut the position or redirect funding from our hot meal program that MPA actually subsidizes. As a direct result of this funding decision by the City of Vancouver, MPA may need to consider significantly reducing or ending the food program for Vancouver's most vulnerable citizens and homeless people in the area. It is important to note that demand for the food program is increasing, and we see that with the increases in the number of homeless in the count. Just for your information, that 16,500 represents over 4,700 meals to the homeless. Alternatively, MPA will be forced to cut the staff position, impacting directly organized activities which would have a pronounced impact on the people and activity in the area. I would anticipate significant increases in calls to police, as MPA will be unable to offer social programming function, a service which provides structure for people who are homeless and are mentally ill. It will also have significant impact on this community integration and relationship with the community. As Superintendent Steve Ely, South Command VPD, can attest, MPA enjoys a positive relationship with the community, and this has had a positive impact on service calls from the community regarding the facility. I make an effort to meet with Superintendent Ely on a regular basis just to confirm that we have a positive relationship and there's no negative impact on the community. It is concerning that staff have not attended the program, sought clarification, or examined the significant impact of this funding cut. Each grant review meeting, the only feedback we receive is the question is why we're not asking more for more, given given all we do. Never has there been a concern or indications that funding may be at risk. I ask that this recommendation be revisited, as city staff may not be aware of the impact or the harm done directly to the homeless individuals and people with mental illness through this decision. Nor does this decision consider the impact on the local neighborhood and community relations.
Can you bring your remarks to a close, Mr. McIntyre? You have questions from council, so he'll have a chance to make further comments.
Thank you.
Thank you. Councillor DeGenova?
Thank you. I just brought up your April 7th email to Mayor and Council.
Yes.
And you had mentioned it in your comments also, but without this $16,500, and I'll ask staff about that also afterwards, you would have to cut the position as a whole, and I understand that that's a paid staff person's position. And I'm wondering how many people that person reaches or serves. And then on the other hand, is it correct to say if you didn't cut that person, you'd have to cut your meal program? And could you please perhaps elaborate on how many people that would affect?
Certainly. Thank you for your question and your time of counsel and interest. With the way the position works, it's a full-time position. I don't have the option to reduce that position by $16,500. So that means that if I'm to keep that position, then I need to come up with the funding for that. As we all know, there's financial pressures on all of our food programs. We see a 6% increase per annum on food costs. We're struggling to keep up, and we're actually funding it through the society ourselves. So what happens is if we don't have that $16,000 from the city that we count on to make that position possible, I either have to reduce that position, which is an unlikely position, or I have to find the $16,000 elsewhere. And the only place that I have it that's not tied up in collective agreements, I can't reduce staff with contracts and that kind of thing. So one of the very few places I can actually withdraw the money from is from the hot meal program for the homeless. As far as how many people it affects, we receive 90 individuals a day that attend the resource center. Many of those people are not connected to mental health teams. We have a homeless outreach worker position, so when people come in for food, we automatically try to connect them with housing, connect them with other services. So this is an integral service to connect and get people off the streets. And one of the key things is we know when you're cold and wet and hungry, giving some shelter and some food and some support is the entrance into the much larger support network that we have available to our citizens.
Thank you. I understand that that's something many councillors have supported and actually said that's a way to get people the supports and help they need. Yes. Another question I have is just in regards to, and I'll ask staff this also, but just in reading the report and reading your email to Mayor and Council, I'm wondering, have you had conversations with staff? Do they understand sort of what dire need you're in for this extra monies, and did you request the extra monies and then it was not the funds were not allocated?
Again, thank you for your question. We've actually been receiving this annual funding since 2010, so we anticipated and planned for it. We had never received any indication that the funding was cut. I did have an opportunity to speak with Mary Claire since the cut was announced, and quite frankly, I was quite shocked and surprised and really concerned because of the negative impact of it. We've since had a number of conversations about the true impact. There seems to be a little bit of confusion around whether or not they were fully informed of the impact of the cuts, but I've certainly made efforts since to show and to demonstrate to the city and to staff around what the true impacts of, although it's a small amount of funding, it's a significant cut that has a significant impact on the people.
And is there any other place that you could go to request this money, like Vancouver Coastal Health? Are there any other avenues? And just in case I don't get it in time, how quickly would you have to make this decision? Are you funded for the rest of the year for this individual? How quickly would you need those funds secured to plan out that position?
At this point, we're looking at all of our options. The program itself has about an $850,000 budget. So we're looking at all sides of this and trying to figure out how to have the least impact. We certainly appreciate the support of the city, albeit quite small, given the services that MPA provides to the city of Vancouver. It is a significant amount of money. So what I've sat down with my finance director and instructed her to do is to try to see what the true impact is. At this point, I'm unable to say. My hope is today that council or staff may be able to reconsider that recommendation and make the existing funding continued.
Okay, thank you very much. My last question would be I just wanted to clarify. Sure. There isn't another agency that you could go to ask for funding at this point, without having to have, I suppose, some type of disruption in the position.
Well, what happens is most of the funding for that program actually comes from Vancouver Coastal Health, and I know Mary Claire, to support us, has contacted them as well. However, with Vancouver Coastal Health and the opiate crisis, getting free money available is very unlikely. And in fact, all we've seen is a series of cuts over the years from Vancouver Coastal Health, not expansion of service. So unfortunately, there isn't another pool of money or another funder standing in line waiting to provide the funds.
Thank you very much.
Thank you for your interest.
Thank you, Councillor Jang.
Thank you very much, Mr. Chair. Good to see you again. It's been a little while since I've been down to your place, but I know you guys do very good work and all that, so I can imagine how loss of funding is a bit of a surprise. On the one hand, I'm just trying to understand sort of the not only the process that you went through was an application to a grant program where you fill out a form. I remember doing them when I was working in nonprofits to the city. And in the past, you said something that the staff told you, cut the funding without consultation. And I want to know what you meant by that. They didn't give you an indication it was going to get cut or what?
Sure, thank you. And thank you for your comments. What we were told, every year since 2010, we have a sit-down meeting with somebody from the city and go over the program as well as the outcomes and that kind of thing. And I'm told that the question was asked, what is the impact of funding cut? I don't recall that conversation because quite frankly, it would have set why I'm here today. It would have set significant alarm bells for me. So for me, how I was notified was that the funding was cut was a voicemail saying that the funding had been cut to the organization and that if I had any questions that I should give them a call because they were having a busy day and wanted to get back to me, which I did appreciate. But that was how I learned. So we didn't have any warning that this was coming that we could plan for. So it really, quite frankly, caught us flat-footed.
Okay. Sort of a follow-up to the amount of funds. On the one hand, you say it's a small amount, 16.5K, and the program itself is 850K, and the bulk of your funding comes from Vancouver Coastal Health, and I know that they're under pressure. They were here today. You were here today.
Yes.
Other foundations have you approached? What I'm really trying to get at, what is your fundraising capacity? So where have you raised funds in the past?
Right.
How much have you raised?
Right.
I thought of Vancouver Foundation. Given what I think this position does, there's BC Housing, and there's other agencies. Could you give me a better picture of your fundraising capacity and how much you've done?
Sure. So our primary funding comes from Vancouver Coastal Health, BC Housing, and Fraser Health. So we in effect are an extension of the services that the health authorities and BC Housing provide. So we don't fundraise significantly for operation of programs. That's never been. We're known for being transparent, effective, and cost-effective providers of service. So we contract directly with the health authorities. As far as your question around we just received notice on Thursday that the funding was cut. So and then that's instantly when we started having conversations with the city about what are the true impacts of this. So I haven't had a chance to go to anyone else. I've spoken to BC Housing, who certainly expressed their condolences. I spoke to Vancouver Coastal Health, who also expressed their condolences, but nobody was writing a check or being able to come up with that shortfall. So
have they given you an opportunity? I mean, I know that you spoke to them. I know it's a very quick turnaround. have they said that there's a program available or that they would consider it, or they just say, too bad, so sad, I guess?
My sense of it is too bad, so sad. It wasn't, oh, well, Dave, you should consider this or you should consider that. I've gone the streets to home. We've started to reach out. My big concern is obviously the quick impact of this is going to have.
Okay, so I'm just running out of time. Sorry, I'm going to cut you off. So the position that you're considering cutting, what does that individual actually do?
So the position is a social programmer, and by training she's a recreational therapist with a specialization in working with people with mental illness. So she runs a whole series of programs. All of our programming is available on our website that we post around. So we have structured activities every day. As we know, when people are homeless or mentally ill, often isolation is a big struggle. So bringing them in and providing structured, organized activities, which not only gives them something to do, but also gives us an opportunity to engage them and get them into housing and other services, that kind of thing. So that's a large focus of her work, is working directly with the people that we serve. And again, we're looking at 90 individuals a day, which translates into the thousands of people over a year.
So even my last 30 seconds, let's say there's no change and you don't get the $16.5 thousand.
Right.
Would you say that recreational program would shut down?
It would be hard for me to cut that down because the other part of her job is to connect with the community, and you'll know from looking at police reports, you'll know from the lack of calls about MPA's resource center from the community that we've been very successful in doing community integration, and she does that. So the art galleries actually show our art. We have partnership with the senior citizens facility next door, the terraces. All that stuff is the community integration. So if I remove that position, it removes our connection to the community where we've been so successful. So I would have to look at the hard choice, which would be cutting the food program, because that's the only thing that I have that is at all able to be moved.
Okay, thank you.
Thank you for your interest.
Thank you, Councillor Ball.
Yes, thank you for coming in. We really appreciate all the amazing work that you do with MPA, and I think all you're trying to let us know is that your clients need you critically and need the services that you're providing. I think any of us who've worked in nonprofits know that the grants are always a long-term effort on behalf of everyone, both the grant providers and people trying to get the funding. And I'm sure in terms of any misunderstanding that can be worked out over time as to what your grantors need to hear, and let's hope we can broaden your base, and I know that there are many of us here who'd be happy to help you do that, but in the meantime I'm sure that we can work it out so that you're not leaving your clients unserved. But thank you for coming in today.
Thank you for your support.
Thank you.
Thank you. That's all your questions.
Yes, thank you.
Thanks for coming today.
Thank you for your time.
Diane Elliott Buckley. Thanks for coming.
Good afternoon, and thank you very much for giving us the opportunity to speak today. I'm here representing the 5 Vancouver family places, and I would like to introduce my colleagues. We have Mary Johnston from East Side Family Place. Tracy Bashara has just stepped out from Marpole Oak Ridge Family Place. Ginny Bonner from Mount Pleasant Family Center Society. Kim Berger from South Vancouver Family Place. And I'm Diane Elliott Buckley from West Side Family Place. First of all, we would like to gratefully acknowledge the support that we have all received from the City of Vancouver over the years. Last year, Family Places welcomed 71,798 individual visits during 4,287 hours of operational program time. And during this period, over 1,500 new families attended a Family Place program for the first time, and Family Place staff provided 4,327 hours of outreach support to parents and caregivers. Each of the 5 family places originated in the 1970s as a grassroots response to the needs of parents, primarily mothers, for a safe, child and family-friendly space to meet for mutual support and connection. And together, we are accessible daily to families and their caregivers across the entire city of Vancouver. Family places provide children with enriched learning opportunities through a play-based program. These programs stimulate cognitive, social, physical, emotional, creative, and early literacy development. Our parent education programs provide knowledge and understanding of child development, while at the same time providing personal support and decreasing social isolation. Our programs enhance healthy child development and build community while respecting and reflecting the widely diverse cultural and socioeconomic experiences of families. Early childhood is a crucial period of human development. Without supportive public policy and needed services, young families are stressed by the demands of caring and earning. All young children and their families should be able to access early childhood development supports and services that they need. Recently, last Thursday, I believe, the 5 family places submitted a letter to Council outlining the many ways that family place programs support the City of Vancouver's Healthy Cities strategy. From providing a good start to children to learning opportunities for parents, the examples are too many to mention here today, but we've talked about them all in our letter. But despite all of this, 36% of Vancouver children now enter kindergarten vulnerable in at least one area of development, either social, emotional, cognitive, communications, or physical. A lack of support in the early years puts children at risk of lifelong health issues, both physical and mental, poor learning outcomes, difficulty with employment, criminality, and other vulnerabilities. Our programs support strong family relationships that help ensure that children are emotionally and physically and intellectually ready for school and for life. The preventative nature of our programs helps reduce the societal contributors to many current health and social issues. And certainly we heard that this morning from both Dr. Kendall and Dr. Daly, who talked about the need for increased investment in early childhood development and talked about it in the context of being a vaccination against mental health and addiction issues later in life. So the need for additional investment in early childhood couldn't be clearer. Therefore, we're asking Council to approve the funding requests of each of the individual 5 family places in full. Furthermore, family places are well suited to be the voice for the early years in Vancouver, and we would be pleased to share our collective experience with the city. We are also looking forward to working with city staff over the coming year to talk about ways we can work together in the future and about opportunities for enhanced operational funding for the 5 family places. Thank you.
Thank you for coming. You have no questions, but I appreciate your time today. Our next speaker is Scott Darling. Is Mr. Darling here for Street Saviors Outreach Society? Don't see Mr. Darling. Member Bayani from Wish Drop-In Center.
Childcare requirements this afternoon, so she had to leave.
Gabby Korcheva from the Bidders Project.
Thank you.
Welcome.
Thank you. Thank you, dear city councilors. My name is Gabby, and I'm the programs manager for the Binners Project. And joining me today is Bertha, also a member of the Binners Project. The Binners Project is a grassroots nonprofit organization, part of Tides Canada, that works with Binners to destigmatize the work that they're doing and also create new income opportunities for themselves. We started over 3 years ago, just meeting in the garage space of the UBC Learning Exchange. We gratefully acknowledge the support of the City of Vancouver throughout these years in helping us get started. The Community Services Grant from the Social Responsibility Fund, where we're receiving funding from, covers a much needed portion of our staff time dedicated to our activities. I myself started with the Binners Project as unpaid staff for the first 9 months or so of my time, and my director, Anna Godfroy, spent even more time unpaid. So we definitely understand and see the need for more staff coverage for nonprofit activities such as ours. The Binners Project is the only initiative in Vancouver that serves Binners at the grassroots level, working on much needed work with social determinants of health and connectivity in the city. The staff time at the project covers five staff members, and this money is heavily invested, this time is heavily invested in the creation of new income opportunities for Binners. So for example, we'll do a bottle pickup services in local businesses, and just last year we recycled over 60,000 bottles and cans through that program alone. We also do events in the city, so we connect with local event organizers, and Binners are able to help with front of house waste sorting services, waste education. And through that alone, last year we generated over 976 hours of economic opportunities that were paid for Binners. Some of the events that we worked with last year and are going to continue with working this year are Fair at the Peony, Catsalano, Car Free Days, and Bertha has participated in some of our events last year, if you wanted to speak more.
Well, yeah, I was with the Binners Project when we were introduced to Kitsilano and the Granville Street Party, and from there, as we profited a lot. Well, us as Binners, anyways, being introduced to people and helping the green products. So far, for example, the bottle pickups, which we recycled more than 6,000 bottles, with the events that we did. And we also had the big peonies. We invited back again this year with the Castellano, which we're very much looking forward to doing a lot more work with them. Thank you.
So thank you very much, City Councilors and Peter Bruckman and Mary Claire Zach for all your support to the Binners Project. It's much needed and very much appreciated. Thank you.
Thank you.
Okay, thank you. And you don't have any questions? So that's all our speakers. Are there any members of council have questions for staff? Is that Councillor Reimer?
Thank you. Well, the perennial question for staff around recommendations for the item, understanding there's a very large pressure on the city's funds, which is the only level of government that's been increasing funding over the last number of years, last 9 years now. To understand the context for the MPA grant not being recommended and what the options are for potentially funding, as well as what would happen if we started trying to override staff, like the process, I guess, like what is the process of appeals, and if we tried to amend your recommendations, how that might impact other grantees.
I'll respond to that. Mary Claire Zach, through the chair, Managing Director, Social Policy. Just to provide some context, and much of it is in the report before you, is that staff received an overwhelming number of applications. This is quite common, but I think we're seeing increased numbers as we go through the year. So there's $7 million worth of grants in front of you. The actual program that was applied to by MPA is about 5 million of that. And staff go through a fairly rigorous process, and I think council is aware that for every application we do a review, we meet with the organization, which did happen in this case. And through the conversation there was, according to my staff, there was a conversation around the impact, and the advice was that it would have some impact, but the program wouldn't shut down. There'd be fewer meals and fewer outings, but the program wouldn't shut down. So now we're hearing different kind of information. The position is an important position. The 16,500 pays for about 15 to 20% of that position. So I do understand from my own perspective with staff that that's a chunk of time. So what we didn't understand, coming back, as you heard Mr. McIntyre, that in fact it is apparently going to cause a significant impact. So in hearing that, I've spoken to Mr. McIntyre over the last couple of days, and even today, is that we're committed to meeting with him and finding out more information about that discrepancy in the information that we got, but also what are those impacts going to be, and whether or not we can bring others to the table as well. I really do think that Vancouver Coastal Health and BC Housing need to be part of this conversation. Certainly this program is part of a almost $900,000 program that's largely funded by Vancouver Coastal. We are all in this together. But I think the basic thing is the basic message I want to get across is that we don't want to see this program shut down. So there should be some ways that we might be able to come up with some funding and through our partners to remedy the situation, so we won't have to see this happen.
May I jump in? Just to answer the second part of your question, Councillor Emmer, which is what might occur if council starts changing all the grant recommendations from staff on the floor of council, because I think that was a chunk of your question. Staff go through a professional adjudication process with interviews and criteria. Each of these grants are scored. There's many more that apply than can be awarded. And so we hope that council will rely on the professional process that staff go through. And my concern, if council were to start changing things on the floor of council, is that every other grantee that isn't awarded, there's about 40 of them, would be coming to council and wanting a similar process. And so it would really erode the process that we go through. And this is just one of many grant programs that we have. So it would encourage you to rely on what Mary Claire has just indicated, which was we will sit down with Mr. McIntyre and their other funding partners and have a conversation about how we can ensure that the program does not erode as a result of this process, and explore other ways that the program can be funded.
So to reflect back to you what I heard, that our job today is to ensure that staff correctly applied the policies that we have put in place, as opposed to provide advice on who and how to fund things. Is that a fair summary? Okay. I will flag for you that, and I appreciate that there are these gaps sometimes between what we hear at some point and impacts. There's another one that falls in that category, which is access pro bono, where the executive director was off when the application went in, but I'll follow up with you about it offline. Okay.
Thank you, Councillor Ball.
Yes, I just wanted to confirm that from having been in the position of applying for grants and not getting them, sometimes it's very helpful because staff do sit down with you and work out what your next steps need to be and where you need to go. And I presume that amount of time will be spent, because it does make a huge difference to an organization, that even one that's been around for a long time, that there may be lots more ways of answering the questions or getting to yes in what the way they need to do it. So I'm just wanted to confirm that time would be available and spent. So.
Yes, that absolutely would be part of the conversation. I think every organization, large, small, or in between, is going through struggles now, given the demand, so that will certainly be part of it.
Thank you. I'm just wondering, I'm hearing from a lot of nonprofits right now who are worried about sounding weak, and they feel that they need to sound strong where they may not be strong on a particular issue, that, yeah, sure, we can make it, we can get it through, but when really the real answer is no, we can't make it without that lever or whatever that help is. And I'm wondering if you're hearing the same kind of things, of stress out there.
So Peter Brookman from Social Policy. When we go out there into the community, we have tended to build up really strong relationships with the organizations that we fund, and that is very much a message that we're hearing. I think organizations tend to feel comfortable in being honest with us, and really saying that, yeah, they are really being stretched. They're seeing cuts coming from a number of different directions. And so this year in particular, and certainly in recent years, we've got organizations that are really desperate. They are being cut to the bone, and are coming back to us and saying we need to be able to support our core funding. And so no, I think your point is very well taken.
I do appreciate it, and thank you. I think the work that we're able to do at the city with this money is phenomenal, and wish there were more. It's amazing the staff can do this much. Thank you.
Thank you. I just wanted to clarify. So I understand that our staff will be working with MPA and to try and see if there are other agencies that would come in to help with the funding of, I understand it's 16,500 that they're short. In future, will this affect the grant amount that they're able to apply for next year when they come back to us? Is there a precedent set by the amount that they're given this year?
Because it's a formal process and it's a competitive process, we can't make any guarantees from 1 year to the next. We really do have to look at the situation and priorities and weigh all of that out through the process.
Just through, and I understand our city manager just explained sort of the formal process, and I appreciate that. Do you look at what was given to an organization the year before when considering their grant application for the next year?
Yes, I believe that is part of the process.
Okay. And I didn't quite get a clear picture of how quickly this funding would have impact. So would staff be meeting quite soon with Mr. McIntyre to?
Yes, we'd be able to do that.
Okay. Thank you very much.
Councillor Reimer, I guess you're ready to move the recommendations?
I am prepared to move the recommendations. I think this is always a challenging moment. So I want to thank staff. I know how many applications you read through. I know that number continues to go up. And as we got a bit of a sense of today, each application involves a back and forth process. And I think probably just by nature of your day-to-day involvement in the work, I think emotionally challenging to have to say no to 40 organizations that are incredibly important key pieces in a community that's increasingly under stress from affordability and senior government policies and global context that's out of our control, but we still have to deal with the results of it. So I wanted to focus a bit on the positive things, because there are some huge positive things here. It's been a very long, hard decade for nonprofits with cuts at the provincial and federal levels. And context, like if it were just the cuts, that would be hard, but growing income, inequality, affordability, all these pressures on top of us are very challenging. I think to read through this report and realize how much this big social grant ship has been able to try and find the most strategic leverage within that to really balance off keeping organizations alive and helping them pivot like Aboriginal Front Door into a more strategic and effective space, working together with others. A lot of hubs and partnerships, seeing the alignment with reconciliation, healthy city strategy, downtown east side, implementation. I appreciated in amongst all of this, the gender equity audit that was done to get a better sense of making sure that a gender that is more vulnerable traditionally is being adequately, in fact, hopefully thriving as a result of the funding that we're able to put in. And of course, hearing the federal government cavalry might be on the horizon, that's probably putting a lot on them, but at least some new money would make, I think, a big difference in what we're able to achieve working with our social grant sector. A few sort of things that I'm hoping we can look forward to, particularly if there's more federal money on the table, is this discussion around multi-year core funding. I think it was just impossible, given all these other things we were trying to manage, hard to think of, but at this point I think we're probably ready to have that discussion. I know as a former nonprofit executive director how much difference it makes to have that more stable funding. And I think also when I was sitting on the Vancouver Foundation board, I mean, it's easier on the grantors too to be able to really focus down on projects each year and core funding to be something that's more administrative in nature. The last thing I wanted to say, because a provincial election is less than a month away and I feel like I'd be abrogating my duty at this microphone to not mention it, there is an opportunity in that election to push candidates to support the public funding of services so that nonprofits aren't having to fill those gaps, as well as ensure that the nonprofit sector, which I think necessarily does some things better, has the access that it needs to stable core funding so that we can provide better services wrapping around for our most vulnerable residents. I'm happy to support the recommendations from staff.
Thank you, Councillor Carr.
Yes, thanks, Mr. Chair. I may have first to thank those who came to speak, both with thanks, but also to explain your programs and to explain how important and the work is and how challenging it is, and also to reveal information that we may not have had before. I think we can improve our decisions always by that input of people who come to speak to us. So it's extremely valuable. And to staff, this is it's a challenging job in a time that the need has never been greater. Somehow it floors me that we have such wealth in our country, our province, our society, and yet we have so many people in such great need. And I'm very proud of the work that you do as staff and that the city has done in terms of budgeting a fairly large amount of money in comparison to other cities towards the support for the kinds of range of programs that you have in here. 142, I'm not going to list them. There's just so many. And I'm really glad you put that Think and Eat Green program in as well, because, as we've heard from some of our speakers, food is incredibly important as a means really of health and social justice. So I am very pleased to support this, and also very happy to hear your willingness as staff, willingness as staff to work afterwards with applicants around finding solutions as well.
Thank you, Councillor DiGenova.
Thank you very much. I'd like to thank the speakers. I'd like to thank the speakers, first of all, for coming and waiting all morning to speak, and for waiting through our lunch break. I'd like to thank our staff, and although I'm very cautious of some of the impact that this decision will have, I know that there were a number of unsuccessful organizations. There always are. That's very difficult. I know that MPA does great work and that they serve a community that we here at City Hall, I think each city councillor at one time or another or many times over have said that we truly need to take more of a focus onto mental health and wellness. And I think that the organization that Mr. McIntyre sort of described takes that even a step further through their meal programs and connecting people to those resources that they otherwise wouldn't have. I'm very happy to support this. That being said, I'm supporting it because I know that our staff do an excellent job. As our city manager said, that there's a process, a rigorous process that each organization has to go through. Councillor Jang can think about I've made grant applications to the Vancouver Foundation for nonprofits too, and it's like writing a book sometimes. It's great to make these applications. I also wanted to acknowledge the effort that goes into each and every one of those applications to the city or to any other organization. I know it's a lot of work. It's often 60 to 70 pages plus your financials and everything else you need to pull up, and sometimes you only have days to do that. So I just wanted to thank everyone, successful or not, for making that time, taking that time away from your nonprofit or your organization to apply. And I'm very confident that our staff will work with Mr. McIntyre and will help to connect with those other agencies and organizations. I don't think it's about pointing fingers. It's about trying to find how we can fund this gap. And $16,500 may seem like a lot of money, but it also, compared to $250,000 that was just spent on a cycling event, $16,500 seems to be quite a bit less than that. So I'm hopeful that our staff will be able to help you find the resources that you need to get the services and supports for the people you serve every day. Thank you.
Thank you, Councillor Louie.
Yes, thanks to the speakers that came today. It does reinforce, I think, the real need and the positive work that's being done by the community outside of government and the partnership that exhibits and why it's so important. Thanks to staff for writing the report and the very challenging task to go through so many applications and then make a hard decision on who to fund. That is a very challenging thing to do. And you do it every year and in the face of increasing pressures. Part of the reason why several years ago I championed the increase of $1 million to this fund in the hopes that it would alleviate some of the pressures. And thankfully, Council of the Day said yes. Unfortunately, that hasn't come to pass. The pressures continue to rise. Our support that we receive from our provincial government has not kept pace with the need, and the same can be said at the federal level as well. And so it is, as Councillor Reimer said, incumbent upon all of us during this opportunity, which is the provincial election, to speak out more clearly and loudly about the need there. It's not as if we are giving this money away. This money, of course, is being leveraged, and through additional funding from other places and organizations, and leveraging a significant amount of human capital into the equation as well. So just to make it clear to the people perhaps online, 181 grants, over $7 million is what the City of Vancouver is putting into these programs. It is not a small amount. It is a big amount that leverages 10 times the amount of benefit to the residents, both in the City of Vancouver and surrounding community as well. We do this with 8 cents of every tax dollar, 8 cents. Every dollar that is paid by a resident in our country, and it's pretty consistent across our entire country, 92% of it goes either to the provincial or federal government. So this needs to be taken in context of what we do despite the fact that we have such a small amount of money made available to us, because we see the value. And so when we take issue with the current school board trustee who cuts adult ed at the schools, that flies in the face of what we try to do here at the city. And when these other types of programs are being cut for the concept of a balanced budget, it is short-sightedness, in my opinion. And so that's why I'm very pleased that the city, once again, is the leader in this regard by providing these types of grants. And I hope that we get some relief from the federal and provincial governments all across our country, because we are in it together. So I will be supporting. Thank you, Mr. Chair.
Thank you, Councillor Louis. Do you have final words, Councillor Reimer? Okay.
Well, my final words are going to be two things. Just because it might have been implied that I had applied to the Vancouver Foundation, I wanted to make sure that that wasn't on record. I was actually on the board, and it would have been totally inappropriate of me to apply to the organization I was on the governance function of. But the main thing that I was trying to get on the queue for is I forgot to thank Councillor Louis, because every year this is made much easier.
What's your point of order, Councillor Dejanova? Sorry, so all right, just a sec, Councillor Stevens.
It's under section 5.2. Councillor Jang is making disparaging comments as he usually does. I haven't yet to this point brought it up in council, but he does this at every meeting to me when he whispers things or says things to me. So if you could ask him to stop, Mr. Chair, I'd really appreciate it. Thank you.
Okay, all councillors are reminded that crosstalk is contrary to the procedure bylaw. Councillor Reimer, would you please continue?
Sure. I think where I was at, I was thanking Councillor Louis, because without his efforts some years ago now, we would have a much harder decision to make today. We'd have $1 million less dollars, so that'd be almost 20% less funding that we'd been handing out. So I wanted to, I see he self-thanks, so I appreciate that, Councillor Louis, because it...
Point of order, I never said that.
And also wanted to note...
Failed. It wasn't enough.
Councillor Louis, please.
Staff have pointed out something that wasn't in the report but is really exciting, and I wanted to share, which is that we are piloting a multi-year funding approach with neighborhood houses. So by this time next year, we'll have some new information about how that might work for organizations we provide core funding to. So thank you to staff for anticipating our desire to move in that direction. Thanks.
Which may mean fewer debates about those issues here. Okay, we'll move to the vote on this matter. All those favor, please show. Opposed, indicate so. Okay, that passes unanimously. Thanks very much. So the standing committee portion of this meeting is now complete, and we'll convene in regular council where there is an additional item.
Mike. We'll now convene and regular the council to deal with the recommendations and actions of today's Standing Committee of Finance and Services meeting. Madam Clerk, could we have the roll call, please?
Mayor Robertson is not in the chamber. Councillor Louise in the chair. Councillor Stevenson.
I'm in the chair too.
Councillor Deal is on medical leave. Councillor Jang. Councillor Reimer. Councillor Meggs.
Here.
Councillor Ball. Councillor Carr. Councillor Affleck. And Councillor DeGenova. You have a quorum, Mr. Acting Mayor.
Thank you. We need a motion to adopt the Standing Committee's recommendations. Moved by Councillor Meggs, seconded by Councillor Jang. Any discussion? All in favor? Any opposed? That's carried unanimously. We have a bylaw. We have a bylaw on the agenda for consideration which relates to the urgent business that was passed yesterday regarding licenses for taxi cabs and dual taxi licenses. Would someone like to move the bylaw? Moved by Councillor Jang, seconded by Councillor Ball. Any discussion on the bylaw? All in favor? Any opposed? That's carried unanimously. Motion to adjourn. Moved by Councillor Jang, seconded by Councillor Carr. All in favor? Any opposed? That's carried. We are adjourned. Thank you.